Right.
Oh, okay. And hello to the members on Zoom as well. Okay. So today I'm going to be first introducing the chief guest. And our chief guest for today is going to be Dr. Satish K. Kapila. And Dr. Satish K. Kapila is a board certified hematologist and oncologist since 2002. He is a diplomate in American Board of Lifestyle Medicine. He is a clinical professor of medicine at the Wright State University in Dayton, Ohio, and he was president of the AAPI. And he also led the Global Healthcare Leaders Program at Harvard Medical School. He has a certification in artificial intelligence in healthcare from Stanford University. And he was the man of the year for the Leukemia and Lymphoma Society in 2018. He was a fellow of American College of Physicians and the recipient of the U.S. Presidential Lifetime Achievement Award in 2023. He was also part of the Association of Physicians from Indian origin, and he's the chair on the oncology track for the Global Health Summit in India. Chairman for the Pathfinder Institute of Pharmacy, Education, and Research in Warangal, India, since 2007. He also conducted in medical seminars in both the US and India, and he's advisor for the Pfizer Multicultural Center for also been involved in several fundraisers for charity and has nonprofit organizations. He is also on the board of trustees for the Leukemia and Lymphoma Society of the Dayton, Ohio chapter. And he has won the Hind Ratna Award in 2010. He also has the Service Award from the India Club in Dayton, Ohio. So can we all give a round of applause for Chief Guest, Dr. Satish Kapila. And now we're going to have recording play.
లైట్ వేసింది చూడు వెల్కమ్ అని రాసింది అడ్రస్ పెట్టింది అదేనా 133 వెల్కమ్ అని రాసింది అదే ఓకే అదే 133 ఓకే అటు అటుక ఎన్ని కంగాయన్న పాదం సైడ్లో ఉన్నది అంటే అవును అదే ఇల్లు చూపించాను అంటున్నావు.
Please mute yourself, guys.
Shashankan, I don't think the Zoom can hear the audio.
Give me a quick second then. Let me quickly check. They're not able to hear the audio. Participants is okay.
I'm going to mute everyone.
Yeah. Yeah, I think the computer audio is not going good. Oh, yeah. Sorry, guys. You should be able to hear now. If not, let me know, Neha.
Hello, everybody. My name is Dr. Satish Kathula. I'm a blood and cancer specialist. I'm the president of American Association of Physicians of Indian Origin, or API. October 13th is World Thrombosis Day. Thrombosis means blood clots, either arterial or venous. 10 million people are diagnosed with venous blood clots every year in the world. 1 in 4 deaths is attributed to venous blood clots or arterial blood clots every year. And then 60% of venous blood clots are due to hospitalizations, either during or after. So prolonged immobilization is also a risk factor. And then trauma travel, prolonged travel, either by road or air, hormone replacement therapy, pregnancy, family history, smoking, age, obesity, and then certain medical conditions like cancer. All of these can predispose people to have venous blood clots. So how do we prevent them? And if somebody is hospitalized, they have to get up and move frequently and get prophylactic blood thinners to prevent blood clots, or what is called SCDs, sequential compression devices, what we call. And even somebody is at home laying in the bed due to sickness, they have to be getting up and moving around frequently as well. Same thing with travel. People who are traveling either by road or air have to get up frequently and move around. And if someone has family history, they have to be more vigilant about the symptoms and signs of the disease or the blood clots. Smokers should quit smoking. Obese people should lose weight. With all these, we can prevent blood clots, which can be life-threatening. And on this day, I want to give one message. To prevent blood clots: move, move, and move. Thank you.
There's one more.
Hello, everybody. My name is Dr. Satish Kathula. I am a cancer and blood specialist. I am the president of American Association of Physicians of Indian Origin, or AAPI. I want to talk about stem cell donation or bone marrow donation because it is very important for Southeast Asians and Indians, because we have very small pool of donors. For example, for Caucasians in this country, the chance of finding a matched donor is about 20 to 30%, whereas for Indians and Southeast Asians, it's less than 0.01%. So if you're 18 to 40 years of age, please consider donating stem cells. It's a simple procedure or process. You basically register your name in certain registries called NMDP, which is National Marrow Donor Program, or DATRI, D-A-T-R-I. They send you a kit. All you need is send a saliva or buccal swab to these registries. And whenever they need you, they will call you. The chance of that is low, but even if they call you to donate stem cells, it's a simple procedure. We put a line, collect stem cells, and that's it. You're done. So it's very simple, life-saving procedure. So I will urge everybody, especially Indians or Southeast Asians, to donate their stem cells, or at least register first. Thank you so much.
Yeah.
Okay, can we get one more round of applause? Okay. Okay, so the next special invitee I'm going to be introducing and will be on Zoom is Dr. Sashi Kuku, and he is a neonatologist based in Louisville, Kentucky. He's a graduate of the Ranganaya Medical College in Kakinada, India, and he completed his pediatric residency at the Cleveland Clinic in Ohio, where he essentially studied neonatology. He did his fellowship at Cincinnati Children's Hospital in Cincinnati, Ohio, and he obtained a master's in healthcare quality and safety management from Thomas Jefferson University in Philadelphia. He was the immediate past president of the Ranganaya Medical College Alumni of North America, and he was elected as president for the Association of Telugu Medical Graduates of the U.S. He is also the chairman of the AAPI Stem Cell and Bone Marrow Donation Committee. And so now we'll be hearing a little bit from Dr. Sachi.
Hello, everybody. Can you guys hear me?
Yes, Dr. Garu. Go ahead.
Hey, guys. Thanks a lot for having me today. And congratulations to you guys for having this, such a nice gathering, creating the awareness of all these deadly diseases. Today, I'm going to a little bit expand on what Dr. Satish Kathula had just said. I am the chair of the program from RP. We're trying to increase the donor pool of Indians, the stem cell and bone marrow donor pool of Indians. Right now, we don't have very many donors. I just spoke to the medical director of the NMDP. That's a kind of like a bone marrow / stem cell bank. where they take the samples and store them, and they match when a recipient needs any stem cells. So I just spoke to him, and what he was telling was really scary, actually. If you're a Caucasian, there is 72%, the odds are 72% of you finding a match and going through with that match, meaning like you not only finding the match is important, but the donor who registered with them probably a few years before, still willing to go through the donation process. That's about 72%. If you're African American, it's very low, it's about 22%. For South Asians, they unfortunately they don't have the data specifically on Indians as of now. He's trying to get me more data, but as of now, they have the South Asian data. For South Asians, the chance of getting that donation and going through the donation process is about 47%. So that means um, only 1 in 2 needy people who are desperate for a match, which is life-saving really, are going to get this match. So what we're trying to do is, as Dr. Katula said, he's the hemonc specialist, hematology and oncology. He's a cancer specialist. So he took upon himself as a chairman of the RP to increase the donor pool of the Indians. Which is fantastic, actually. Let me very briefly, I know you guys have a very busy program ahead. Let me briefly explain what does the program involves in really like in 2 minutes, and then I'll take some questions. What it involves is the number one, the first step is to register with this NMDP. That's kind of again a blood bank kind of organization. That's a bank for the stem cells and bone marrows. And first of all, we are going to provide you a code, QR code. If you click your camera onto that, that will take you to their website. You put in your personal details, your name and age and address kind of details, and then they will send you a swab, kind of like a buccal or cheek swab, where you swab your cheek and send it to them. Then they will type it and they'll store it. And then if at all somebody needs you get matched with somebody, a patient, then they will call you. Then once they call you, there are 2 types of donations you can do. One is stem cell donation, and the other one is bone marrow donation. For some reason, bone marrow donation has got so much prominence over stem cell donation, but 9 out of 10 donations, what the recipient needs is stem cell. Only 1 out of 10 is bone marrow. Stem cells is easy to donate. It's just like a blood donation, really. It takes about 3 to 4 hours for the whole process. Not like they're not going to take all your blood in like 3 to 4 hours. They take some blood. They just filter the stem cell out, and then they put everything back. So it's not like they're not even taking your whole blood. They just take the stem cells and then put everything else back. Actually, it takes about like 4 to 5 hours really at the max, and that's it. Hopefully a life will be saved because of that. And the bone marrow donation is a little bit more cumbersome. It involves more processing. It takes about probably 8 to 9 hours spread over 4 to 6 weeks. So you have to go under like general anesthesia, and then they harvest your bone marrow. Again, it's only like 1 in 10. So that's kind of like a process. The good thing is, for example, if you get matched, the NMDP pays everything for you. Like for your travel, if you need to go somewhere, they will pay for the travel. They will pay if for your like last wages. They will pay for your transportation. They will pay everything really, and they raise the money through donations and all those things. But you just get the satisfaction of saving a life. I was speaking to one of my friends recently here in Louisville. He's a 70-year-old man. He donated probably 25, 30 years ago. And then he was telling me that his donation saved a 70-year-old Latino girl. Usually usually they don't disclose the recipient's name unless the recipient is okay to disclose the name. So he knew not the name but the details of the person really. But imagine saving a life. I'm a neonatologist. I look after premature babies who are babies born at like 6 months and 7 months. The reason why I became a neonatologist is a firm belief that if I'm good at what I do, I can give the best start possible to a person, and that person tomorrow may become whoever he or she wants to become really. So that's the reason why I became a neonatologist. But you can do exactly the same thing. You can donate really literally life to a person who is in need, and that person who knows what that person is going to achieve tomorrow and how that person is going to change the world. And one more thing, again, before I close, when we met students back in India in like probably 35 years ago, there used to be this like big stigma about like blood donation. Donating blood is huge. Like blood is like needed. We cannot manufacture in the factory. People have to donate it. So when we needed it, the relatives or like husbands and fathers or sons, they used to say, oh, we don't want to donate because we will become weak, we will not be able to function, we will not be able to work. So that was a stigma at that time. Fortunately, it has changed. At that time, med students and residents and fellows back home in India, they used to donate to save the life, really. So that is a stigma at the time. That was just pure lack of awareness, just on like blood transfusion. Fortunately, things have moved on. There's so much awareness right now. Giving blood is not a problem at all. Everybody just like walks in and gives, just because there's no stigma. There's a lot of like awareness right now. Unfortunately, what I'm seeing is I am seeing with the stem cell donation the same lack of awareness. I'm not going to call it stigma, but the same lack of awareness what I used to see 30 years ago for blood transfusion. Clearly, there is no complication, like zero complications to the donor. The only thing the donor we need from the donor is just like willingness to donate. So step one, please register at the website your personal details. Number two, when they send a swab, please swab yourself. My daughter is in secondary college right now in DC. She swabbed herself recently. That's so easy to swab and send it back. Please don't keep the swab with you because that involves some cost and they're losing some money. NMDP raises the money through donations and they really put a lot of work in getting this money. So when people get the swabs and they don't send it back, it's a waste of like resources for them. So please send the swab back. And then if at all you get matched, then you can think about like either donating, whether to go through the donation or not. So so that's what I want to say. I know your time is precious. If time is allowed, I can take some questions.
Yeah, thanks, Dr. Garu. Maybe we'll take the questions later, Andy. We are already running late. Thanks for your kind words. And also, Atmiya and UPASA are a 4,000 family organization. So we'll definitely spread awareness about the bone marrow donation program, which you are, involved in. Thanks again, Dr. Garu. Over to Neha. We can start with the presentation.
Okay, can we get a round of applause for Dr. Garu? It's so great that he's spreading awareness about stem cell and bone marrow donations because it's definitely a need in our society today. There's also another website called Be the Match, and that is also a U.S. national board that also does the same process. So you can also work with them as well with these types of donations. So now we're going to go into the student presentation. And for the first session, so session one, the chair for this will be Shruti Akula, and the co-chair will be Niharika Kodapalli. Okay. And our first student presentation is going to be me, Neha Dariwadigu, and my presentation is going to be on venous thromboembolism post-COVID-19.
Neha, where is your presentation? This one, right? Yeah. And slideshow.
Okay. Hello, everyone. My name is Neha. Today, I'm going to be talking about the impacts of COVID-19 and the health impacts that it had on venous thromboembolism.
Can you just give me a second? Yeah, you can share. So they'll not be seeing the person? Person good. Yeah. Go. The video.
So for my presentation, I looked at multiple different tertiary sources. I looked at not only the JAMA network, but also the NIH, and which is essentially the National Institute of Health. And so I will be specifically focusing on one primary source from there. So first I want to discuss what exactly is venous thromboembolism. And for this, I used research from the CDC as well as the National Heart, Lung, and Blood Institute. And so venous thromboembolism is essentially just referring to blood clots within the veins. And there's specifically two types of venous thromboembolism, and those include deep vein thrombosis, or DVT, as well as pulmonary embolism. And DVT essentially occurs within a blood clot that develops in a deep vein. So a deep vein would be anything in the lower leg, the thigh, the pelvis, and in some cases it can happen in the arm. And so pulmonary embolism, however, is incredibly life-threatening because essentially a part of a clot is going to break off in a different section of the body, and it's going to travel to the lung arteries and affect specifically your lung. And so DVT and pulmonary embolism are often incredibly underdiagnosed, but are serious and often preventable conditions. And it is important to know about venous thromboembolism in general because it can happen to anybody and can cause serious illness, disability, and in some cases, death. Oh, next slide. Okay. Yes. So this is an image of deep vein thrombosis, and essentially what we are looking at here is there's a vein in the lower leg of this patient's leg, in the lower leg of this patient, and essentially there's a blood clot within this vein that's creating a blockage. And so what happens with deep vein thrombosis is that a lot of patients don't understand that they're having symptoms, or they also don't show any symptoms of having deep vein thrombosis. And about half of them essentially undergo this issue. And so they don't understand how dangerous it can be and how life-threatening. And pulmonary embolism also is essentially where this clot right here had broken off from another section of the body, and it had traveled to this specific lung artery and is now infecting the lungs. And the issue with pulmonary embolism and the reason why it's so dangerous is also the same reason that we looked at with DVT, where we essentially saw that a lot of patients don't really show symptoms, and so they don't understand what type of condition they have. So now I'm going to be talking about the NIH tertiary source that I reviewed, and essentially this discussed the risk of thrombosis during and after a COVID-19 infection. And so the question that was essentially asked was that are individuals who face the COVID-19 infection more likely to experience VTE, venous thromboembolism, than individuals who did not have the COVID-19 infection? And so the COVID-19 infection essentially increased the risk of thromboembolism, especially in patients who face severe conditions that required intensive care and cardiorespiratory support past the original amount that they needed. And so COVID-19 patients with these thromboembolic conditions essentially had a higher risk of death. And if they essentially survived the process, then these complications were going to negatively impact their quality of life. So some of the more recent data from this tertiary source essentially stated that the risk of thromboembolism remained incredibly high even after multiple months have passed after a patient had COVID-19. And so we're going to look at why exactly do patients who are significantly affected by the COVID-19 infection have a higher risk of venous thromboembolism than those who are not. And the reason why is essentially, next slide. The reason why is essentially a multitude of risk factors, and risk factors include any sort of major surgery, major injury, or periods of infection and inflammation that the patient is not moving, or the patient is sitting still or standing still in a very long period of time. And so that's typically going to be a lack of movement after surgery or when traveling long distance. And then inflammation and serious infection, and then the condition having to stay in the hospital for a very long time also increases the likelihood of having venous thromboembolism. Okay, and that's it for my presentation. Thank you so much. So the next student I will be presenting is going to be Atmiya, and she's going to be presenting cavernous sinus thrombosis, and her mentor is going to be Dr. Ravi Atmiya. And so can we have...
She's on Zoom.
Oh, he's on Zoom. Okay.
Anvita, are you here on Zoom?
Yes. Hello.
Yeah, we can see you now. And let me make you the co-host quickly.
ఇప్పుడే ఆన్ చేసిన ఏదో జూమ్ మీటింగ్ హౌ కెన్ ఐ
Yeah, Anvita, can you try sharing your...
And she need to unmute, I guess, Shashank.
Yeah, also you can unmute yourself, Anvita. No hurry, take your time. No, we are not able to hear you, Anvita. So you should see an option to unmute yourself on the Zoom app. Yeah.
So now I will share my screen.
Right.
So my name is Anvita Pupala. I am a 9th grader from San Antonio, Texas, and today I will be presenting a rare but serious condition known as cavernous sinus thrombosis. So cavernous sinus thrombosis is a condition where a blood clot is formed within the cavernous sinus area right behind the eye and presents with a wide variety of clinical consequences. To understand this condition, we must first understand what the cavernous sinus is. So the cavernous sinus is one of the dural venous sinuses in the head, and it's a network of veins that drain into the cavity. And as you can see, and it's right behind the eye, and several important anatomical structures in the face, including some cranial nerves, pass through this sinus. So right here you can see, so the cranial nerve is of close proximity to many important nerves, such as the sympathetic nerve and also the oculomotor nerve, ophthalmic nerve. So these are important cranial nerves that are connected to the sinus, and they help to function for the brain. And it also is in close proximity to sphenoid bones, which help to support skull structure. So this triangle area right here is the danger area of the face in between the nose and the mouth. And it's known as this because they all drain back to the cavernous sinus, the veins in this area. So if an infection were to spread on your face, it would all go back to the sinus to right behind near your brain. And this can cause blood clots, which can restrict blood flow from your brain and your eyes, ears, and parts of your face, which can cause serious problems. So it's important to know not to pick any pimples or boils on your face because this can lead to serious infection that can spread to your cavernous sinus. So there are many clinical manifestations of cavernous sinus thrombosis. Some include orbital pain like eye pain, redness such as swelling of the eyes, vision loss, drooping eyelids. Headaches are very common, vomiting, fever seizures, sleep deprivation, and cranial nerve signs. Right here are some examples. Here you can see that one of the eyes are paralyzed. There's swelling of the eyes and drooping, and also facial pain. So the most common cause of cavernous sinus thrombosis are bacterial infections that can spread from the sinuses, teeth, ears, eyes, nose, or skin of the face and cause severe blood clotting. It can also be caused by head trauma, tumors, many different cancers, or it can also is common in immunocompromised patients, such as patients with diabetes or hypertension. So it is a very rare condition with 4.5 cases approximately in a population of 1 million per year. But however, the mortality rate is very high, up to 30%. And it also causes serious health issues such as blindness, which can be lifelong if not treated in time, and cranial nerve palsy is not uncommon. So the most common way that doctors diagnose this thrombosis is through CT and MRI scans, which they use to detect these types of blood clots in the brain. As they're highly sensitive, they're easily able to detect them. So they're highly useful in detecting these types of clots in the brain. And this also helps them to prevent any serious issues. So there are many treatments. There are some treatments for this type of thrombosis, such as IV antibiotics, which can be taken at least for 3 to 4 weeks, steroids, anticoagulation, and if there is no response or in extreme situations, surgical intervention is necessary. So although this is a very rare condition, it does have
It's 19 hours.
It does have serious consequences. So it's important that more information about this condition is known. Thank you.
Good job, Anvita. Did really well.
Thank you.
Yeah, thanks, Anvita. Over to Neha.
Okay, can we get one more round of applause for Anvita?
Thank you.
Okay, thank you so much. And now we're going to move on to Nihar Pilla, and he's going to be presenting on coronary thrombosis with Dr. Ravi Abdullah as his mentor.
Can I get the ability to screen share?
Yeah, you can now.
All right, thank you.
Yeah, Nihar, we can see you. You can start on.
Yeah. Can you see the?
Yes, we can.
Hello, my name is Nihar Pilla. I'm a freshman at Providence.
Yeah, go ahead. Yeah, sorry.
All right. Yeah, no, it's fine. I'm a freshman at Providence High School in North Carolina. I'll be presenting on coronary thrombosis in honor of World Thrombosis Day. Coronary thrombosis is when a blood clot forms in a coronary blood vessel, a blood vessel in the heart. It can cause blood flow to get blocked in the coronary blood vessels and cause tissue death. Most common causes of heart attack or cholesterol buildup, and sometimes the coronary thrombosis can form on top of it, causing a heart attack. Oh, sorry. Alright, so some symptoms are severe pain in the chest and arms, sweating, upper body discomfort, trouble breathing, and or difficulty having the ability to. Alright, so one cause of coronary thrombosis um, is the blood flow getting. It's when blood flow becomes sluggish, and this increases the chance of blood clotting and blocking the flow of blood. Some risk factors include old age, family history of coronary thrombosis, smoking, sedentary lifestyle, obesity, injury or surgery, chronic inflammatory diseases, high blood pressure, type 1 or type 2 diabetes, high cholesterol, or an unhealthy diet. Some treatment methods include blood thinning medications, such as aspirin, or emergency operations to restore normal blood flow to your heart or to remove the clot. A stent is used to open up the blood vessel in these operations around the thrombosis. Some ways to prevent coronary thrombosis is to regularly exercise and have a healthy amount of fat, and also eat a nutritious diet with fruits, vegetables, whole grains, lean protein, fish, nuts, and olive oil. And try to avoid unhealthy foods such as sweets, fried foods, red and processed meats, and full-fat dairy products. And that's it. Thank you.
Good job, Nehar.
Can we get a little bit louder, a little bit louder? Okay. And now we're going to move on to Shruti Akula, and she's going to be presenting on retinal vein occlusion and essentially retinal thrombosis.
Yeah, I think we'll be playing Shruti's video. Yeah, you want to say that. Yeah, so Shruti Akula, she's not here today. So we'll be playing her video. She sent her presentation as a video format. So
hello everyone. Today, in honor of Thrombosis Day, I'll be discussing a condition closely tied to vascular health and blood clots in the veins of the eye, retinal vein occlusions, or RVOs. RVOs are a common cause of vision loss worldwide and are associated with thrombotic events in the retinal veins. They occur when a clot blocks the flow of blood in the retinal veins, leading to complications that affect vision. So, what is the retina? The retina is a thin layer of wallpaper-like tissue at the back of the eye that plays a crucial role in the vision. It contains specialized cells called photoreceptors, which detect light and convert it into electrical signals. These signals are then transmitted to the brain via the optic nerve, where they're interpreted as the images that we see. Retinal vein occlusion happens when a blood clot blocks a vein in the retina. There are two main types of RVOs. Central retinal vein occlusions are where the clot forms in the central retinal vein that drains blood from the entire retina. CRVOs are less common but more severe because they affect vision more broadly. Branch retinal vein occlusions are where a clot forms in one of the smaller branch veins. This affects only part of the retina, and vision loss is typically more localized. Both types of RVO can lead to complications that affect vision, like macular edema, or swelling of the central retina responsible for the sharp vision resulting in blurry or distorted vision, retinal ischemia, or lack of oxygen to the retina, and the growth of abnormal blood vessels that can lead to more severe problems such as glaucoma or retinal detachment. RVO is multifactorial in origin. The primary risk factors include age, hypertension, hyperlipidemia, and diabetes. Conditions that promote thrombosis can also increase the risk of RVOs. Additionally, ocular conditions like glaucoma or narrowing of the arteries in the eye, can contribute by placing mechanical pressure on the veins, increasing the chance of a clot forming. Patients often present with sudden, painless vision loss, which can be partial or complete depending on the extent of the occlusion. In BRVO, vision loss is usually restricted to a quadrant of the retina, while CRVO typically results in more severe, widespread loss. Ophthalmologists can diagnose RVOs using a combination of fundoscopy, OCT, and fluorescein angiography. Fundoscopy can allow for the visualization of signs like dilated veins, hemorrhages, and cotton wool spots. OCT is a 3D imaging modality that provides a cross-section of the retina and allows for visualizing swelling in the retina. And fluorescein angiography is a dye test used to highlight blood flow and reveal blockages or damage in the retinal vessels. These images are fundus photographs of the retina. This is what an ophthalmologist sees when they perform a dilated fundus exam. The image on the left shows a normal retina, with the yellow circle being the optic nerve and the red lines being retinal arteries and veins. The image on the right shows a retina with a branch retinal vein occlusion. Hemorrhages, or spots of blood, can be seen superiorly with enlarged veins and the small yellow circles or cotton wool spots, which are signs of damage to the retina. Management and treatment consists of anti-VEGF injections, laser, and management of systemic risk factors. Medications like Lucentis or Eylea are used to reduce swelling in the retina and prevent the growth of abnormal blood vessels. In severe cases, especially in CRVOs, laser treatments may be needed to prevent complications like neovascular glaucoma. Controlling conditions like high blood pressure, high cholesterol, and diabetes is also essential to reduce the risk of recurrence. Thank you for your attention.
Okay, so Dr. Shruti Akula is currently in the operating room. So
hello, everyone. Today, in honor of Thrombosis Day, I'll
do one more pause for our hard work and next up, and the last person in session one of our student presentation is going to be Niharika Kotapalli, and she will also be on Zoom. And she's going to be presenting post-COVID-19 pulmonary embolism.
Hello. Okay, do I have access to share? Okay.
Yeah, Niha, go ahead.
Okay. Okay, let me see.
Yeah, we can see your presentation, yeah?
Okay, perfect.
Yeah, you can go ahead.
Okay. So, hello everyone. My name is Niharika Kotapalli, and I'll be presenting on post-COVID-19 pulmonary embolisms today. I would like to just say I'm very happy to be here today for our annual World Thrombosis Day event because it is a very widespread condition affecting 1 in 4 people worldwide. So I believe that it should be discussed and brought attention to. So that being said, I would like to start my presentation with a case so we can see how pulmonary embolisms might present. So this is the case report. So in this case, a 41-year-old male visited the ER with chest pain and a dry cough. His vitals and physical exam appeared to be normal, as well as his chest X-ray. And his past medical history showed asthma that has been controlled with medications. However, laboratory work showed an elevated D-dimer count of about 8,051 nanograms per milliliter, while the normal counts are 500 nanograms per milliliter or less. So this is when the physicians took a chest CT angiography, and it revealed extensive bilateral pulmonary embolisms. He was later found to be positive for COVID-19 as well, but displayed no other symptoms other than this. And he was given anticoagulants as treatment and was discharged with no other complications. So I wanted to mention this case because he presented with minimal symptoms and chest pain, which may lead someone to think that is a cardiac related issue. However, the underlying cause of his chest pain was the pulmonary embolisms, which are putting pressure on his heart because of the obstruction in blood flow to his lungs. However, his D-dimer count indicated that he might have some type of underlying blood clotting issue, which was later confirmed with the chest CT angiography. So this is just one case in which pulmonary embolisms can present themselves. So what is a pulmonary embolism? Pulmonary embolisms occur when a blood clot forms in the arteries of the lungs and causes a blockage in the vessel. They typically start as a blood clot in the deep veins of the leg, deep vein thrombosis, which break off and travel to the arteries of the lungs. In other rare cases, the blockages can be caused by air bubbles, tumors, or fat that has been released after surgery, traumas, or bone fractures. So there are several different risk factors that can increase the chances of developing a pulmonary embolism, as well as other thrombotic conditions. These include a sedentary lifestyle, which can lead to slowed down blood flow and pooling in blood vessels, certain medications, obesity, and age, which can alter the body's coagulation factors, surgery, injury, or COVID-19, which could lead to damaged blood vessels and inflammation, and genetic factors such as factor V Leiden mutation, protein S and C deficiency, antithrombin deficiency, and factor II mutations. Some of these factors play a role in anticoagulation or normal blood clotting. However, when mutated or deficient can lead to increased coagulation. Therefore, all of these are risk factors that can lead to increased susceptibility to forming dangerous blood clots. So next, we're going to discuss the symptoms related to pulmonary embolisms. These differ based on the size of the clot, extent of lung involvement, and overall health status. Some common symptoms include shortness of breath, chest pain, coughing, lightheadedness, dizziness, increased heart rate, and more. So many of these symptoms also present in heart attacks, aortic dissection, or pneumonia, so it can be very easy to misinterpret it as something else. That's why it's very important that further testing is done to diagnose and treat this condition effectively. As in the first case we discussed, the patient came in with chest pain and a dry cough. However, the physicians were able to diagnose it as a pulmonary embolism after receiving D-dimer counts and a chest CT angiography. So that brings us to diagnosis of pulmonary embolisms. Common diagnostic tests include blood tests, which can check for the blood's clotting status and D-dimer counts, chest CT angiography, which can be used to examine the blood vessels and show any blockages, duplex ultrasonography to check for blood flow in the vessels, ventilation perfusion scans to check for air and blood flow in the lungs, and finally, pulmonary angiograms to check for the blood vessels and blood flow in the lungs as well. Next, we have treatments. Some common treatments include anticoagulants such as warfarin or heparin, which can be used to stop new clots from forming and pre-existing clots from getting bigger. Fibrinolytic agents, which can be used to dissolve clots by breaking down fibrins, vena cava filters, which can prevent clots from migrating to the lungs, and in more severe cases, surgical intervention, such as pulmonary embolectomy, where a clot is surgically removed, or percutaneous thromboectomy, where a catheter is inserted into the blood vessel to extract or dissolve the clot. So to sum it all up, we'll just look at pulmonary embolism incidence in relation to COVID-19. As I was looking into these studies, they have shown increased risk and incidence of pulmonary embolism in hospitalized COVID-19 patients, as well as increased thrombotic events post-COVID-19 diagnosis. So that sums up my presentation on pulmonary embolisms. Thank you for listening.
So that was all of the session one student presentation. Now we are going to have a quick Q&A and session one recap by the chair, Shruti Akula, and co-chair Niharika Kotapalli. But because Shruti couldn't make it today, our co-chair will be leading these Q&A.
So Neha, you're the co-chair and we have 5 minutes. So you can just call out for any Q&A.
Yeah, we can take any questions that anyone might have had on the presentations.
Yeah. Let me first check in the Austin event room here. Do you have any questions on this section one topics? Anyone from the Austin room? Yeah, there's one.
There's one.
Good evening all, my name is Krishna and my question is, what are the long-term effects for a person who was already diagnosed with DVT in 2017 and she was diagnosed under the anticoagulants of heparin for a longer time? And in 2022 or 21, she got COVID, but she recovered well. And I would like to know what are the long-term risks for her? Can you hear me?
So Neha, do you want to call out any doctor's name who can answer the question? Yeah, Ravi Aklagaru, or maybe he can answer the question.
So if I understand that the question is long-term consequences of this thromboembolism, is that right?
Yeah, Ravi Gar, go ahead, Andy.
The question I want to understand, is that the question?
Yes.
Okay. So there's a very good question. Can you ask her to come close to the camera, please?
Yeah.
She looks young. I'm kind of curious. How old are you, Amma?
I'm 33.
Okay. So, okay, that's a very good question. But I'll, instead of me answering the question, I would like to ask Neha, the first presenter. Can you come in front of the camera, please? Neha.
Yes.
By the way, you did an excellent job, Neha. So the question I have for you is,
Sir, name pettinda sir, kani adi last sentence appudu gautam.
So can you ask that question? If not, I'll help you. So the question is, you presented on COVID and thromboembolism. So the question this young lady was asking, what will happen on long term? You did treat, and same thing, Niharika also presented on that. You guys treated this patient, you took care of the problem, but what are the long term consequences? Are there any long term consequences?
So based on my research, the long-term consequences were essentially just negatively impacted quality of life in general. And that was simply because if a patient had COVID-19, they would essentially be dealing with venous thromboembolism, and then they would be staying in the hospital for a long period of time in order to essentially be treated with the infection and go under intensive care. And so I simply was able to understand that it was negative.
Anything to add, Niharika?
For long-term effects?
Yes.
It does look like it was altering the coagulation factors within people. So that could also lead to like thrombotic events later on.
So what will happen is, when there's a clot, I hope you understand the question. I didn't get her name, the young lady who asked the question. When you have a clot, you gave the medication to take care of that clot, either in the leg, that is DVT, or in the lungs, that is pulmonary embolism. So most of the times you give medication that will resolve, but sometimes there could be some fibrotic changes. That means the clot is not completely dissolved, but it can organize. It can get organized, and long term that can cause pulmonary hypertension. That means it can raise the pressure in the lungs. Okay, there are different kinds of pulmonary hypertension. This post-thrombotic pulmonary hypertension is one of 5. So the answer to your question, there could be long-term sequelae, but coming back to Neha, the first presenter, is a very interesting thing because post-COVID, we are still learning. In fact, Dr. Kumar Kotupalli asked me to talk about the interesting case. In fact, last week I was on consult service. We saw a patient, and it's very confusing. This guy had like almost 20,000 troponin. Troponin is a marker we check with a blood test. Anything more than 50, we'll be all worried about heart attack. But this guy had a 20 or 22,000. And obviously, and we found he had clots in the lungs. And the same thing we don't know if he had clots in his heart, as Nihar was presenting. Usually, most common, you can have narrowing of the coronary arteries, heart arteries. On top of that, you can develop a clot. So right now, in COVID case, it's so confusing. So the answer to your question is this patient who had clot in the legs or lungs, we treat that, but it's very important to follow up with your doctor to make sure there are no future sequelae. Did I answer that question, Amma? Did you understand what I said?
Yes, doctor. Thank you for that. She's my mother actually. We had a DBT and it was like my mother had a basic keyhole surgery for her kidney stone, and later within 10 days she was diagnosed with a DBT, and she was under heparin for almost seven and a half months. And till now we are taking her for Doppler scanning for every 1 year, and 6 months earlier, and from last couple of years, we are taking her for every 1 year under Doppler scanning, which will essentially check for the clots in the entire body, or not even like only on the veins, like where are the veins are flowing, right? So all those were taken care. But the thing is that she already had a COVID, which was pretty serious, but she recovered that one as well. So it's like the out of taking care of how to take care of my mother. So that's what I have asked this question. But I'm really thankful that you have answered this question.
Good. I'm glad.
Yeah, thanks, Ravi Garu. Ravi Garu, in the interest of time, we need to move on, Andy. And
please.
The next set of sessions, we have a special guest talk later with all the doctors, Andy. So over to Neha. We'll start with the second session.
Can we get a round of applause for Dr. Ravi? Okay, so now we're going to be doing our Section Tuesday presentations, and this is going to be with the chair, Dr. Soumya Manji, as well as the co-chairs, Gadu Vijay. And the first person who'll be presenting is Dr. Soumya, and she's going to be presenting on post-thrombotic panic syndrome.
Yeah, go ahead.
Good evening, everyone. I'm Soumya, and I'm going to talk about post-thrombotic panic syndrome today. And to start with post-thrombotic panic syndrome, traumatic events are quite traumatic events are unexpected and life-threatening. This leaves the patients with the fear of reoccurrence, panic, the reminder of the traumatic events, health anxiety, and sometimes even anger of the misdiagnosis. This leads the patients with dealing with panic and with panic. The panic symptoms, unfortunately, the panic symptoms and the symptoms of thrombotic events are quite similar. This starts a vicious panic cycle called the post-thrombotic panic syndrome. The panic cycle is triggered by sensations like those that the patient might have experienced at the time of thrombosis. For example, when you're exercising, you might feel some tension in your muscles and some shortness of breath. This might take you back to the time when you have experienced the thrombotic episode. This triggers the worrisome thoughts, inevitably making you feel anxious. This anxiety leads you to become physically tense, and it worsens your shortness of breath and muscle tension. And that further confirms that you really have a physical problem and turns this anxiety into a full-blown panic attack. So today, let us learn how to deal with this panic management, how to prevent and manage. So to prevent panic, we must be aware of the times or situations in which you have previously felt panicky or the anxiety. Be ready to spot early on the feelings of anxiety or panic and deal with them before they have blown in, they become too difficult to handle. It is better to handle with panic before it completely sets in. You have sensations that make you feel fearful of having a further thrombosis. Do not immediately panic. Allow yourself to consider that these sensations might be normal and and immediately begin to use breathing and calming exercises. So today, let us learn some of these coping mechanisms, calming exercises, breathing techniques, and muscle relaxation techniques, starting with the calming exercise. The panicky thoughts are the most difficult things to alter because they come quickly to the mind and are very difficult to deal with. Because they are the triggers to panic, it is important to address them early on. So the key here is to give yourself the calm down messages, like you have to tell yourself, I've had these sensations before, so this might not be a comforting memory. And coming to breathing exercises, you can also practice some breathing exercises to get your breathing back in control. To do this, place your hand, find a comfortable position, place a hand on your abdomen, and feel your belly expand with every inhalation. There is a technique called the box breathing exercise that is also called the Thrombosis pranayama. For this exercise, you need to inhale for 4 seconds, and then hold it for 4 seconds. Now exhale for 4 seconds, and then again hold, pause for 4 seconds. Repeat this until your breathing is back in control. And then if you still feel that your breathing is not in control, you can think that this is about fever. And for the breathing exercises, also relax your muscle tension. If you still feel like your muscle tension is not firm, there are deep relaxation techniques. There is a technique called progressive muscle relaxation. So for this technique, try to find a comfortable position, preferably lying down position, and breathe in and tense each muscle group for 5 seconds before breathing out and relaxing that muscle. So start with taking full deep breaths and start from your feet and go upwards. Squeeze your foot for 5 seconds and relax. And before you move on to the next muscle group, take 2 to 3 slow deep breaths to notice how your body is feeling. Now squeeze your legs for 5 seconds and relax. Squeeze your stomach for 5 seconds and then relax. Now moving up to your shoulders. Shut your shoulders for 5 seconds and then relax. Now squeeze your arms and hands 5 seconds and then relax. Squeeze your whole body for 5 seconds and relax. Now take 3 full deep breaths and notice how you're feeling. If the symptoms still continue and after you have your breathing and relaxation under control, consider seeking help. Thank you.
So now we're going to move on to our second presentation in the seventh session. And so this will be Soumya Nutta, and she will be on Zoom, and she's going to be presenting stroke risk post-COVID-19. And Dr. Ram Kola was her mentor. And for the students who are on Zoom, make sure that you share the slides presentation that is in the Google Drive.
Yeah, thanks, Neha. Soumyanaka, are you here on the Zoom call?
Yes, hello.
Oh, hi. I just. Yeah, you should be able to present now.
Okay, thank you.
Yeah.
It says that multiple presenters aren't allowed for this meeting.
Can you try now, Soumya?
Yeah, it's working. Thank you. Hi, is it visible?
Yes.
Okay, so hello everyone. My presentation is about stroke risk COVID-19, and it will mainly focus on discussing the data and statistics that we have on this issue. So what is a stroke? A stroke is a medical emergency that occurs when something blocks blood supply to part of the brain or when blood vessels in the brain burst. An ischemic stroke, which are majority of stroke, results from blood clots or when other particles block blood vessels. On the other hand, hemorrhagic strokes result from arteries in the brain leaking blood or rupturing. So one of the most important parts of detecting a stroke are early symptoms or warnings. Some of these can include trouble speaking or walking, sudden numbness in the face, arms, and legs, and this typically happens on one side of the body. Some possible outcomes of this include brain damage, death, cognitive issues, and long-term disabilities. Some of these disabilities and issues are impaired speech, weakness of the limbs, and difficulty gripping. So how does COVID-19 lead to stroke? So the effect of COVID on stroke is still being studied and the exact mechanism is unknown, but most researchers agree on the fact that it's due to the infection of cells. So the virus which COVID-19 stems from is SARS-CoV-2. So when this infects endothelial cells, which are cells that line the inside of blood vessels and the heart, they form a single layer of cells and regulate the exchange of materials between the bloodstream and surrounding tissues. After this happens, the infected cells attract immune cells to the area by releasing pro-inflammatory factors. In response to this, the immune cells make their own inflammatory factors and and often these activate platelets because the cells are damaged. Platelets or thrombocytes are small, dish-shaped, colorless fragments in our blood that form clots to prevent bleeding. After a blood clot is created, there's an increased risk of it traveling to the brain and leading to stroke. COVID-19's association with, I lost the access to share again.
Yeah, can you reshare it?
Yeah, 1 second.
Yeah, can you try resharing, Soumya?
Yeah, sorry, 1 minute.
No way.
Is it visible again?
Yeah, it's loading. We can see your screen.
Okay, is it good now?
It's still loading. Yeah, maybe you can, now put it in the slideshow mode.
Is that good?
No. So you can do one thing, Soumya. You can remove the slideshow mode and yeah, we can see this if you want to quickly zoom that.
Okay.
You have something? Yeah. Yeah, I can share it, but she's already in the middle. But yeah. Yeah, go ahead, Soumya.
Okay. I'll start at the last part. So,
Sure.
COVID-19's association with stroke mainly surrounds ischemic strokes, which are caused by blood clots. However, patients with COVID-19 have also had hemorrhagic strokes from ruptured blood vessels. AIS and COVID-19. So, studies suggest that patients with both acute ischemic stroke, called AIS, and COVID-19 had an increased risk of dangerous outcomes concerning their health. In addition to this, in comparison to patients who only had AIS and no COVID-19, those with both tended to be younger and had a greater proportions of large vessel blockages. So when we say younger, we don't really mean around children or young adults, but really younger than 65, which is the mean value in the studies. Other differences included that the patients were more likely to be non-Hispanic, Black, Hispanic, or Asian. They also had greater stroke severity and longer times for brain imaging needles and EVT. EVT stands for endovascular thrombectomy. It's a surgical procedure that treats ischemic strokes by removing a blood clot from a blocked artery in the brain. They also had increased odds for in-hospitality mortality and decreased odds for being discharged. So prior studies have also shown delays in door-to-door diagnosis and intervention times. So one cause of this may be the fact that during the pandemic, there were many required protocols for protecting both the well-being of patients, doctors, and nurses. So because these required protocols took more time, there was a challenge for completing tasks more quickly. Findings from studies. So this comes from a range of studies. Each bullet point will show a new study. One study found that the risk of stroke was 10 times higher than usual during the first 3 days after COVID-19 diagnosis. This was most commonly found between the age range of 65 to 74, and also in those who had no history of a stroke prior to the one they had post-COVID-19. Researchers found that even post-COVID-19, patients had a 53% higher risk of having a stroke or TIA. A TIA is known as a transient ischemic attack, where there is a temporary disruption in blood supply to the brain. And this happened around 12 months after the patient's diagnosis. So ischemic stroke occurred in 4.40 per 1,000 individuals who experienced COVID-19 in their lifetime, compared to a 3.25 per 1,000 individuals. This data was gathered from a group of 20 million adult patients, and those involved in the studies were more frequently male, and the mean age was 56. In one case study in 2021, which only studied around 18 people, it was suggested that people who tested positive for the SARS-CoV-2 had an increased risk of stroke. However, these individuals also had no respiratory systems, while those with just COVID-19 struggled from the virus attacking their lungs and respiratory system. The median value for the time span between positive COVID-19 result and stroke was around 54 days. And finally, a study in 2022 with 216 COVID-19 patients, and it took place around 20 different stroke centers across the United States and Canada, showed that stroke risk and COVID-19 had lower mortality rates and characteristics of poor outcomes. The study showed that 51.3% of stroke outcomes were poor, and mortality rate was around 39.1%. Some identified factors of the poor income included, but was not limited to, age older than 60, diabetes, blockage of large arteries, and a higher neutrophil to lymphocyte ratio. A neutrophil to lymphocyte ratio, abbreviated through NLR, measures the balance between inflammation and immunity in the body. It's calculated by dividing the number of neutrophils by the number of lymphocytes in a blood sample. Both neutrophils and lymphocytes are white blood cells that work together to protect the body from infection and inflammation. And in this case, in the last study, it was seen in severe cases where fatigue, dry cough, fever, pneumonia, and acute respiratory infection and organ failure were common. Findings from a new study. So the UK Biobank published this around 3 days ago, and the lead research author of the study, James Hilser, claimed that he and his group found a long-term cardiovascular health risk associated with COVID, especially among people with more severe COVID-19 cases that required hospitalization. Hilser wrote that this increased risk is persistent and can still be detected in cases 3 years after the pandemic. He also wrote that even without cardiovascular disease or type 2 diabetes, the study showed that those hospitalized by COVID-19 had a 21% greater risk of heart attack, stroke, and death in comparison with people who only had cardiovascular disease or type 2 diabetes and no COVID. Another significant part of the study is they were one of the first studies who studied blood type. So, the researchers found that there was a genetic interaction seen among non-O blood types and hospitalization for COVID-19. Those with a more severe case of coronavirus 2 had an increased risk of heart attack and stroke, but this value was even greater in people who had non-O blood types such as A, B, and AB. It was 65% higher than those with O blood types. And additionally, a preliminary analysis showed no interaction between the rhesus factor, or Rh, which is an inherited protein on the surface of the blood, with severe cases of COVID-19. So this research was gathered from a large-scale study of around 500,000 adults living in the United Kingdom. The ages were between 40 and 69, and the health and biomedical information was gathered for people registered for the UK National Health Services. So one of the most important parts of stroke is prevention. One strategy to detect stroke is called B-FAST. The B stands for balance, E for eyes, F for face droop, A for arm weakness, S for speech problems, and T for time. So make sure to watch out for these symptoms and be cautious of time. Recognizing early signs of stroke is fundamental, whether or not an individual has previously had COVID-19 or any conditions that may lead to an increased risk of stroke. Similar to the statistics surrounding the mean value of those who experience strokes and COVID-19, this emergency is more common in later ages, which is around over 55 and 70. However, both children and adults can experience a stroke. Other medical conditions can also lead to the increase of stroke. Some include high blood pressure, high cholesterol, type 2 diabetes, and people who have already had a history of stroke, heart attack, or irregular heart rhythms such as atrial fibrillation. These factors can also affect an individual's experience with respiratory issues and COVID-19. These are my sources, and thank you, and I hope everyone stays healthy.
Thanks, Atmiya. Next.
Okay, can we get one more round of applause? Okay, so our next presenter is going to be Pranika Kurella, and she is also going to be on Zoom. Her presentation is about COVID-19 associated with thrombosis complications in children, and her mentor is Dr. Venkata Nagin.
Yeah, Pranika, you can share your screen. Awesome.
Okay, can you guys see?
Yes, we can see your screen.
Hello, everyone. My name is Pranika Kurella, and today I'm doing a presentation on COVID-19 associated thrombosis complications in children in honor of World Thrombosis Day. That being said, let's get started. So first, let's refresh what effects thrombosis and COVID have on the body. Thrombosis is the formation of a blood clot within a blood vessel, causing an obstruction of blood flow. If it occurs in arteries, it is called arterial thrombosis, and if it occurs in veins, it's called venous thrombosis. In this picture, we can see the formation of a blood clot stopping the blood flow. Thrombosis has many factors as to why it has occurred, some being maybe that you either have a slow blood flow or increased blood clotting tendencies, or even an injury to blood vessels could cause it. Thrombosis is very lethal and could lead to serious complications if it dislodges, like a heart attack, or a stroke. On this picture to the right, we can see a patient's legs displaying the physical effects of thrombosis. Now that we have reviewed thrombosis, let's take a look at COVID-19, also known as SARS-CoV-2. COVID-19, as we know, is a viral virus that is usually spread through respiratory droplets, like when an infected person sneezes or coughs. It is also spread through surface contamination and aerosols, which are small particles that linger in the air. Symptoms include fever, cough, shortness of breath, fatigue, loss of taste and smell, and muscle or body aches. Severe cases can lead to respiratory distress, known as ARDS, or organ failure, or even death. COVID-19 and thrombosis is not as common in pediatric patients than adults, but it still happens. The National Library of Medicine states that COVID-19 has been linked to the development of venous thromboembolism, also known as VTE, and deep vein thrombosis, DVT, arterial thrombosis, and microvascular thrombosis. A 28% mortality rate has been reported for pediatric patients with COVID-19, or MISC, that have developed thrombosis. MISC stands for multi-system inflammatory syndrome. It is a hyperinflammatory condition that is very common with kids and is interlinked with COVID-19. Thrombosis and COVID-19 have a lower fatality rate than in adults for children than in adults. This is because they respond well to treatment. This is unless there is a serious complication. For example, the thrombosis can lead to a pulmonary embolism. But besides that, with regular monitoring and proper care, the vast majority of children will recover. Now, the reason why COVID-19 increases the risk of thrombosis has many reasons, one being because of inflammation. The virus triggers a high inflammatory response, causing your body to activate the coagulation cascade, forming many clots. Patients with severe illnesses may be immobile, leading to blood pooling and clot risk. There's also something called endothelial dysfunction. COVID-19 can cause damage to the endothelial cells lining your blood vessels, causing severe clotting again. Then we also have cytokine storm. This is when your immune system receives overwhelming instructions and the immune response can cause your body to clot even more. Specifically in children, they may experience that hyperinflammatory condition called MISC, also increasing clotting risk. One big thing is while being hospitalized within severe illness and the patient is not getting enough activity, this can contribute to clot formation because the patient is immobile. So we know the cause and the effects and why this happens, but how can you prevent it? Well, to help prevent COVID-19 associated thrombosis complications in children, it is best to ensure that children are fully vaccinated against COVID-19, monitoring the child's health properly, and also ensuring that your child is hydrated and getting regular movement and is staying active. And if your child has any underlying conditions, properly working with healthcare providers to manage that, since it would increase thrombotic risk, and getting preventative meds will also help. And finally, it is best to follow public health guidelines. For example, during the peak of COVID-19, we were asked to wear masks, social distance, and practice proper hygiene to reduce the risk of infection. Now, don't forget to also educate yourself a little more about MISC, multi-system inflammatory syndrome, because it directly relates to COVID-19 and thrombosis, especially in children. In this picture to the right, we can see step by step what happens when doctors are trying to find evidence for COVID-19 and thrombosis, showing the environment of care, the trials performed, the guidelines, and how we treat. Research indicates that thrombosis in pediatric patients with COVID is significantly lower than in adults. This issue is still being monitored by health organizations while data is still being recorded. Thank you so much for listening to this presentation on COVID-19 associated thrombosis complications in children. In summary, we looked at cause and effects for thrombosis in COVID-19 and preventative care and stats. Thank you.
Next up, we have Saryu Veju, and she's going to be presenting on long COVID-19 thromboembolism complications, and her mentor is going to be Dr. Ang. And then once again, make sure to share your Google Slides presentation from the Google Drive.
Hello, do I have access to screen share?
Yes, Amma, go ahead, Saryu. Hello.
Hello, thank you, Uncle. Okay. One minute, please.
Sure.
Is this visible?
Yes.
Okay, great. 1 minute. Okay. Okay. Hello, everyone. My name is Saryu Veju,
And today I'll be presenting about long COVID-19 and thromboembolism complications. So before I start, I would like to begin with making sure everyone understands the importance of discussing thrombosis and COVID-19. While we might not be in the height of the pandemic, COVID-19 cases are still prevalent, and it's important to be aware of what's going on. So let's discuss about long COVID. Long COVID essentially refers to a chronic condition that occurs after SARS-CoV-2 infection. And in order for a COVID infection to qualify as long COVID, it must have occurred for at least 3 months. So let's discuss the main points about long COVID. Long COVID is very serious and often requires comprehensive care. It includes a wide variety of symptoms that can span for months to even years after COVID-19 infection. Long COVID rates have decreased since the rise of the pandemic, but it is still a prevalent health issue. And interesting factor about long COVID is that there's no biomarker available to diagnose a long COVID patient. And this, we will discuss this later. There's a lot of ongoing research about this, and connecting COVID-19 to thrombosis has revealed the possibility of a biomarker. So in case you guys are wondering what exactly a biomarker is, we can think about the certain tests and swabs that we did during COVID-19. So for example, some of the tests were the rapid antigen test, which checked for specific proteins of the virus, and the PCR test, which checked for a specific genetic material from the COVID virus. So proper testing like this isn't available for diagnosing long COVID, and that's why long COVID can be so debilitating, because people aren't able to get the proper treatment they need as soon as possible. So what are the risk factors of long COVID? It is important to note that anyone who gets infected with COVID can experience long COVID, from children to adults. But studies have shown there are certain groups that are more prone to developing long COVID, such as women, Hispanic, and Latino people, people who experience severe COVID-19 illness, for example, those who required hospitalization, elderly adults over 65, those who are unvaccinated, and those who have underlying health conditions such as asthma and diabetes. Symptoms. So more than 200 symptoms have been linked to long COVID. And the reason for this, which we'll discuss later, is because long COVID impacts the blood, and without adequate blood supply and proper quality of blood to the body, it impacts all the various areas of the body, as shown in this diagram to the right. So symptoms of long COVID can emerge, resolve, and emerge over time. The most common symptoms of long COVID include extreme tiredness, especially after activity, problems with memory, often called brain fog, and a light feeling of being lightheaded or dizzy. Other symptoms of long COVID include sleep problems, shortness of breath, fast or irregular heartbeat, and digestion problems. So let's quickly just go over what thrombosis is, as this discussion is, we're talking about the connections between COVID and thrombosis. Thrombosis is essentially characterized by the formation of a thrombus, a blood clot, inside a blood vessel. So clots can break off and travel to other locations of the body, which is why they're so life-threatening. And now the connection. So Professor Risa Pretorius in South Africa observed that there were blood-related symptoms in COVID patients. And observing the blood of long COVID patients can reveal more information about long COVID. So one main change that COVID caused was spike proteins of the COVID virus, leading to microclots. So typically in the human body, we have soluble clotting proteins, such as fibrinogen. And these clotting proteins, they're present in our blood to help with clot formation after a normal injury, and they usually break down right after. However, the COVID spike protein can transform normal soluble clotting proteins into insoluble microclots. So these clots made by long COVID are made of unique proteins, an abnormal variation of fibrin, and they create an unusual amyloid structure. So to the right, we have an image that kind of shows the SARS-CoV-2 spike protein structure. Another change that is caused by COVID is platelet activation. So platelets are cells that aid in clotting. But in response to COVID-19 infection, we have the overactivation of platelets, and when these platelets aggregate, we can have excessive clotting. Another impact of COVID is endothelium damage. So endothelium is the inner lining of the blood vessels. So when COVID infection damages this lining, which leads to excessive clotting. So to the right, we have a fluorescent image of a microclot from a long COVID patient. So overall, we have COVID causing different microclots to occur. So some people may be able to break down these insoluble microclots, but other people, these microclots may remain in their bloodstream. So persistent microclots can block blood flow to vital organs, leading to symptoms such as fatigue, brain fog, and organ dysfunction, which, as discussed before, are the conditions most commonly associated with long COVID. So impaired blood flow to the vital organs is likely the factor behind the widespread and whole body symptoms of long COVID. So in this image, we have a great diagram that basically shows the various thrombosis-related effects of SARS-CoV-2 virus. So at the top of the image, we see the entry of the virus. As soon as the virus enters the body, we have an impact on the endothelial cells, which in turn triggers an inflammatory response. So as the virus spreads, the body releases a variety of inflammatory chemicals, which are shown in the top in these pink boxes. And these chemicals signal the immune system to respond to the infection. So the virus directly damages endothelial cells in the blood vessels, and it disrupts blood flow and vessel function, and that's what causes more and more blood clots to form. Another thing that occurs is the activation of mononuclear cells, which are a certain type of white blood cells that, once activated, promote blood clotting by releasing tissue factors. As a result of the activation of the mononuclear cells, we have thrombin generation, which is a clotting enzyme, abnormal fibrin turnover, which is another clotting factor, and secondary fibrinolysis, which basically is stating that the breakdown of clots is dysfunctional, so clots aren't being dissolved properly. As a result, we have blood clots and increased levels of D-dimer. So statistics. The impacts of the occurrence of blood clot related issues after COVID diagnosis is very high. So we can see that as much as 49 weeks later after COVID-19 diagnosis, the risk for blood clot related issues was much higher for those with COVID-19 compared to those without COVID-19. And there are more statistics presented as well. So in a study that involved 1.4 million people, 10,500 individuals suffered cases of clot-related issues. So these statistics show it is very important to bring light to the connection between long COVID and thrombosis. And to the right, we actually have a real-life image of a post-COVID arterial thrombus of the lower extremities. So impact. While these microclots can cause various fatal issues, they may serve as biodetectors to detect long COVID. So in the future, when there are cases of long COVID, perhaps we could use studying the clotting factors of the blood to see if an individual has long COVID, helping them to have better targeted treatment. Thank you so much for your time and for listening to this presentation.
And we have one more round of applause for that. Okay, now we're going to move on to our last student presentation for the second session. And this is going to be Harshita Degala. And she's going to be on Zoom, and she's going to be presenting about brain stroke for with her mentor, Dr.
Harshita, are you on the call? I don't see your name.
She can make questions on that.
Oh, then
We can play.
it's not a video for Harshita. It's a slideshow.
Slide.
Oh, okay. Harshita. Oh, yeah. Not a video. No, it's not a video. It's a slideshow.
Just can you show the slides on that?
Okay, please.
So, do you want to explain? You want to explain about the topic? Okay. Just show the slides. Oh, this one? Out of presentation mode. Okay. Oh, you want to try?
I'll just try.
No, it's good. I think it has to be downloaded and then played. Actually,
Download it into PowerPoint.
PowerPoint. Yeah.
Do you want to try it later?
Oh, maybe later.
Later? Okay.
Yeah.
Yeah. We can do the Q&A and you can try.
Yeah.
So for our first couple presentations, we're now going to start the Q&A section and the quick recap with the chair, Dr. Sonia, and then the co-chair, Sanu. So Dr. Sonia will take.
You have any questions? Soumya, Pranika, Sarilu, everybody talked about the presentation. They all talked about how COVID-19 is affecting the thrombosis. They went into great detail. Do you have any questions?
Is far behind us or far ahead, thinking like break off actually something 5 minutes break it. Yeah, late. Yeah, we'll give a break for 5 minutes. Let's grab pizza and then we'll.
So now we're gonna do a very quick break. We're gonna do a light dinner with pizza. I know everyone's excited and we can refresh a little after listening to so much content. And finish with the vision presentation.
Oh, after,
Later.
yeah.
Okay. And then after that, we'll have coach presentation. Okay, so just first.
Yeah, quick share. Group it quickly. All keeps get running.
Yes. All right. So it is 3, 1. 3, 2, 1. One more time. Please. I was just like, yeah. Okay, so see you.
Which water cups? Shashank, I'll log in later.
Yeah, sure, Ravi garu. We'll start off in 5 to 10 minutes, Sanjay.
Okay.
Maybe Shruti. Yeah.
Ram Garu, can you hear us, Andy? Ram Garu?
Hello?
Yeah, Ram Garu. You can go ahead, Andy. Ram Garu.
Andy?
Yeah, Ramkula garu, we have in our schedule, we have a 3-minute talk for you, Andy.
Okay, Andy.
Yeah, you can start off, Andy.
I can start off? Okay. నేను రవి గారు వెళ్తున్నారేమో అనుకున్నా ముందు.
Go ahead, you can go and Ram Garu. I'll do it.
Yeah, Ravi garu is also here, Andy. Yeah, after you, Ravi garu will talk, and then Hari Kuragaya will talk.
Hi everyone, Andy. I'm Dr. Ram Kola. I'm a physiatrist and physical medicine and rehabilitation MD. Can you guys hear me?
Yes, Andy, we can hear you.
Thanks, Kumar Kotwali garu, to organize this, and Shashank organizing this event today. World Thrombosis Day. I think it's tomorrow, am I right? 12th is a day? World Thrombosis Day?
Yeah, it's October 13th, Andy. Yeah, right.
October 13th, yeah. So basically, why we need to do an World Thrombosis Day that everyone is talking about is to give awareness to everyone what is thrombosis and what are the consequences of thrombosis. Main thing I would like to talk in a few minutes of take it regarding. I have a personal case which we dealt in COVID in India, and I was with the treatment, with the surgeries, the whole part of the treatment. So I will share some of those images. I think I'm a visual learner, so I don't believe in paragraphs. I'll put some slides that I have. These are original slides, not copied from any textbook. And Sir, you also showed one of those. We both shared one slide from that. Let's see. All the kids are tech-savvy kids. I'm not that tech-savvy. Let me see how can I share my screen with you guys.
Ramgari, you should be able to see an option, Andy, on the bottom.
Bottom, yes.
It says share.
Want to share?
Yeah, you if you're ready to share, you can click share, Andy.
Is it there? Can you see my screen?
No.
Why is it not allowing me to do it? It's giving in a trouble image. Can you look at it?
Yeah. Are you able to see that option itself?
Yeah, I'm going to see that the green one.
Yeah.
Okay. I think so. Sorry, guys. I used to do it, but now I'm not able to. Yeah, now got it. Can you see?
Oh, yes, Andy. We can see your screen now.
Okay. What about now?
Yes.
All right. This is a real case that we dealt with, an arterial and thrombosis of the lower extremities, and it was an acute event. Let me give us a brief history of the patient. The patient is a 70-year-old male who had COVID in 2021, and he was admitted to the hospital, was in ICU, got all the antiviral treatments. He got breathing got better, and after 5 days of treatments, of ICU treatments, the patient was discharged home. At home, he was discharged in the evening. In the middle of the night, he developed severe pain in both the legs, the whole legs. So he couldn't bear it. We brought him back to the hospital the next day in the morning, and when they did test the ultrasound of the legs, there was clots in both the legs. Because they're acute clots, the patient wasn't heparin, but at home they were giving oral medication to keep the clots down, anticoagulants. And they had to do an emergency thrombectomy. The removal of thrombus from any artery is known as thrombectomy. So they did bilateral lower extremities thrombectomy and then immediately on day 6. But in fact, the patient was so unlucky, the left leg, lower extremity was thrombosed again. So they did a second thrombectomy in 48 hours. All right. So that is the case that we dealt with. Now that is the acute stage. Now we're going to see how the patient has progressed over the years. I think we're going to take, 2021 until today, how he got better or what kind of complications he got. Let's go back. This is Sarayu Viju. We are sharing the same slides. These are the real clots after thrombectomy, immediate after thrombectomy. One is the right one is the left one. This C big thread-like thrombus. There's a real thrombus. We took the picture immediately after the surgery. Okay. The patient had an angiogram. Angiogram is that we put dye into the arteries and take series of pictures. I'm bad with preparing slides, but the big arrow that I put in, everyone can see that arrow. So to my right side, the right side is the left when you look at the images, and the left side is the one you see. The right is the right, the left is the contrast. There's less contrast here on your screen to right side. When you look at it, the contrast flow is less. So this thrombus in it. So after the surgery, if you look at this, there's dye flowing all the way to the legs. Before we go back, it's only there's less dye going to the legs, especially on the left side. So let's go back to see this post-COVID and after the surgery. These are the thrombus they got done. Okay, now this is after thrombectomy. You see the big toe. We are talking about the left leg. If we look at the big toe, it is a little bit dusky. Still, it is alive. When you go back to later, like I think it's now maybe 2 or 3 weeks, see the discoloration of the skin and the toenail is dying. We thought that will die off and come for will peel off, but it didn't go through that the way we thought of doing it. And see this, the toe is dying. I think this is a month or 2 months into post-COVID after the surgeries. But at this time, when we had this one, we did the 3rd surgery for the patient. We did a bypass. So we did a bypass surgery from the top of the blockage to the bottom of the leg. They did a vein. They took out the vein and they put it there to bypass the flow of that blockage. So this is, I think, is almost 3 months now into it. The toe is dying. The second toe is also dying here. Then the problem is 6 months into it, he had infection of the toe, first and second toe, and a very big gash in it, and they had to do a resurgery, take out all the pus, all the dead tissue. Sorry for having a gross picture on the screen, but this is a real picture that we took care of it. And after that, we did some grafts on it after it healed, and it looks like this. He lost 2 toes, and this is what the leg looked like after a year of treatments, man without a toe. And this is what it looked like. I think the picture, it was the 1, 2, 3. Okay, then he had a second toe infection because he already compromised with his blood flow to the legs, was already weak. And he had a blister on his second toe, and we had to get amputated, and it fell off, and we had to put on antibiotics for this, but for a prolonged time. I think this is after a year that he got this, but this is after a year, and it got healed. The toe that we're talking about got healed. There's still healing there, so he had a blister because the skin is so thin. Even a small rash or small rub on it, you get skin changes. And this is the toe it looks like now. This is the second toe, the toe, the front part of the toe. And this is what that it looked like at present right now. Skin is that was very thin. If you scratch it, you get infections. So looking at it, COVID has taken a toll on all the family members because of this infection, losing a toe. The patient himself is depressed right now. He used to be very active, but is depressed, is not doing much work, or he walks with a cane, with a boot on it, with a toe filler kind of attachment. So post-COVID has given a dramatic psychological effect, depression, mood disorders, you name it, confusion, dementia. As one of the ladies was talking about, what are the complications post-COVID? There are wide variety of things, as Dr. Aklov mentioned. We're still new to it, but it has affected the whole gamut, the brain, the lungs, the kidneys, the legs, you name it. So we all have complications with that. So with that,
thanks, Ram Garu. Ram Garu, in interest of time, we need to move on, Andy. Thank you so much for your talk. And thanks for mentoring the kids, Andy. I know almost 4 to 5 mere mentor chesaru ee roju.
Yeah, I think only few of them have responded, so not a problem.
Yeah.
Okay.
Thanks, Andy. Dr. Ravi Garu, you can go ahead, Andy. Sorry to interrupt you, Andy.
Nothing in the interest of time. So I want to congratulate all the organizers and also the participants. More than I'm not going to talk anything medical, but I want to let the parents, especially of these participants, how much benefit they're getting out of this. Obviously, this is good for the CV, but again, look at the bigger picture. The amount of, especially some of the presentation I've seen, they did an excellent job. And I heard Neha, who is doing a very good job, because this is an experience that will help them in their interviews and also down the road when they're preparing their presentations. That'll be a huge thing for them. So look at the bigger picture, and I really think all these participants will get more than just putting in their CV. All this experience will count. Mark my words, when you're going for interviews and also the presentation when you're in medical school, residency, fellowship, even after in your medical career, it'll help a long way. Thank you very much, all the organizers, for giving me this opportunity. Thank you.
Yeah, thanks, Ravi garu. Thanks so much, Andy. Next, we have Hari Kuragaila garandi. He's out of the box guest today. Hari garu, quick introduction and your 2 cents about the event, Andy.
Yeah, sure. Thanks, Ashank. Happy Dasara, everyone. I'm Hari Kuragaila, and it's awesome to be here remotely from Seattle with all of the future medical pioneers. Now, I'll be honest, I'm not a doctor. You won't find me in a lab coat or performing a surgery. But what I do know is the technology and how to build to help people achieve their dreams. Many of you probably know me from the tests you take to go into college, the ACTs, SATs, and those kind of things. Well, I was lucky enough to be part of the teams that built the technology behind those exams, and even some of the online assessments for grad schools like GRE and TOEFL. But today isn't about the test. It's about something way cooler, the future of medicine. I am incredibly honored to be here alongside with these amazing experts, and huge thanks to Dr. Kumar Garu for this opportunity. Seeing all of you present your research is truly inspiring. You're already doing incredible things, and I wish I had this kind of exposure when I was your age. Think about it. You are surrounded by some of these brightest minds in medicine, people who are pushing boundaries of what's possible. Just this week, the Nobel Prize in Chemistry was awarded for the breakthrough in AI that are changing how we understand and design proteins. Those tiny machines that do everything in our bodies. Just to explain a bit, imagine these proteins like the engine of a car. Genomics is the blueprint for that whole car. mRNA is the instruction for building the engine. But proteins folding is how all these parts come together to actually work. AI, the artificial intelligence, is now helping us understand this process. An incredible detail leading to faster drug discovery and personalized medicine. This could mean new treatments for diseases like cancer, Alzheimer's, and even COVID-19 that many of you presented, are tailored specifically to individual persons. And guess what? You can be part of this revolution. You have the potential to generate those groundbreaking ideas and use these advanced tools to make a real difference in this world. Don't underestimate yourselves. To share a quick story, back in 2015, I built a company called Dash Analytics. We used AI to help doctors predict if patients would need to come back to hospital after surgery. It was challenging. AI, the machine learning was still developing at that stage, and we had to work around a lot of limitations with medical data. But we did it. We built a system that helped the doctors to make this a better decision and improve patient care. If I could do that back then, imagine what you can achieve now with all the technology and expertise available around you with all these uncles. So my advice to you is this: aim high. Don't settle for small wins. You have the potential to change the world, and I can't wait to see what you accomplish. Thank you, UPASA and Atmiya collaboration. Would love to see more into the future. Thank you.
Thanks, Hari garu. Nice motivational speech, Hari garu. Thanks so much, Andy. Neha, you want to take over the next set of speakers? Yeah. Oh, already later than mine. Okay. Ramgal will share some personal experience.
Yeah, I'm Babu Puriti, here, I'm here to present our experience from a patient perspective rather than a medical fraternity perspective, right? So thanks to all the doctors who are very helpful and kind to be part of this event. and all the UPASA team to organize this event. Okay, let me get into the details. So I had personal experience from my family, 2 instances of this thrombosis. So then I realized previously when I had a lot of these things before, I never cared about it. But this is such an important thing for every one of us to learn and understand what it is and what impact it will. But these things could come suddenly. So you wouldn't know unless you have the experience, unless you have the knowledge about it actually. Okay, I'll probably switch back and forth in Telugu and English. Okay, please bear with me. So the first instance is my cousin of Kamma. She's just married 2 years into, and she's a US resident. So what happened is she became pregnant and she was turning around. I mean, she was in her 6 month. So obviously she went to, see her parents in India, and then everything was good. Her husband was good. Everything was fine, and she was returning back to US. So she came on a long flight, and she was there. Journey was good. Everything was good, and she came home. And 3 days later, she was admitted to hospital, and she died suddenly. So it was like really, really surprising what could happen. She was very healthy. Her pregnancy was progressing well. She was doing all good. But then when the doctors did the root cause analysis, what happened was she was on the flight. She was traveling almost like 14 hours or so, and she didn't move at all. Actually, she was in the seat. She was just staying there because I guess she didn't feel like, or it was too much for her to move around. But then a clot formed in her, I guess, veins or somewhere. And then 3 days later into that, I think it traveled somewhere. Again, you know all of it by now. But it traveled somewhere and it impacted her. And then she died within 3 days. And they didn't realize that it was happening also. It's all because of, you must have already heard, right? So it's all because you didn't have the motion for a long time and you were not moving. So blood clots were bound to form. So it was a very tragic experience. But if any one of our people in the family knew about it, at least we could have alerted her to move around a little bit, or could have, when she had developed some sort of symptoms, I would have rushed to hospital, etc. But by the time it happened, it was too late. And then it's like a very good, healthy life. I would say even 2 lives, right, are gone. And it was very tragic experience. So that taught us the importance of, that taught us the knowledge of actually what a blood clot is. Even though like we have doctors in our family, we never paid attention to that. Okay. The next instance is even more personal to us. My wife, Sabita Boditi, she's there in the room here. Last year, what happened was she had a injury on her hand, and it was a lot of blood loss, etc. And we had to rush to emergency, and then we had to go through a surgeon, and then the surgeon has done the surgery for about 4 or 5 hours. It was a complicated surgery, but we took care of the condition, right? So, and then post surgery, she was in the home, and then it was like about 3 or 4 days. She could not move at all. Actually, she was on the bed. So we were all good, but because we were taking care of her actually, but she couldn't move basically. So, and on the 5th day, when we went to the doctor, and she started feeling something uneasy, even after having pain medication, she started feeling something uneasy on her calves, around the area of calves, basically the deep veins, right? So, and then we were lucky enough that she spotted it, and then she told me, but then it struck to me that something wrong was going on. So, and then at the same time, we had a therapist appointment also. So we went to the therapist, and the therapist looked at her, and then she said, okay, I had something going on here. And then the therapist, and that looks like medical community knows about it. So that the therapist simply measured the leg circumference on one side and the other side. And he said, okay, something serious about to talk to doctor. Basically, it's such a simple thing. I think the medical fraternity knows, but the general community do not know how to feel it actually. It's always better to talk to the doctor when you have such a thing. But luckily, then when he said, we texted the doctor because he's a very good surgeon, right? The surgeon immediately called me back. I was so surprised actually, because doctors don't respond and like a day or two later, right? But within a minute, he called me back and said, "Okay, no, you need to go to emergency, and I'm going to order a MRI." So we got an MRI appointment within like a couple of hours in Round Rock. We went there, we took the MRI, and then they said, "Yeah, there is something." There comes the help from our team and our Atmiya team or UPASA team. I called Dr. Kumar Kottapalli garu, and he said, "Okay, Damugar, this is a serious condition. You need to attend." So that was a whole night of experience. Our family was on the road. It was like a kind of like a weekend. It was already like 8 p.m., 9 p.m. We wanted to know where to go. We wanted to go to a hematologist, but the hematologist was not available. So we rushed to Dell Medical downtown, and then we went into ER actually, pretty much. So the ER doctors looked at it, and then they gave some medication. And then, like, I mean, when we went to the doctor, yes, we felt safe, like something is being done. And the next day, I mean, the doctor to, I mean, one thing I just want all of you to know, right? When such a thing happens, the doctor to go to is hematologist, actually. We found a hematologist, a great Indian hematologist called Nihar Patel. He was a great doctor. We were very, very satisfied. And then, I mean, when you identify the condition, the solution is very simple. Okay, just take, I think they have a simple medicine called Eliquis. They prescribed, and then we started taking, and then it's all good actually. I think that was a very life-saving experience. Had it not been done, we don't know, because we don't know what could happen, right? If we had waited like 3-4 days, we already had one experience. But I'm very glad actually and so thankful to Kumar Katwaligar. He was on the phone for almost in a period of 3-4 hours. He was like continuously we talked about like 7-8 times easily, right? He was guiding us to go through which center, which place, etc. We scanned through all the hospitals, and we finally narrowed down to Dell Medical, and then it was all positive experience. But I just wanted to share with you, just know, I mean, I know the kids who are medical aspirants, they have all this research, etc. But it's important for us to know what it is and how to respond to that when such a condition happens. Again, thank you, Dr. Kumar Garu and doctor's team to help with that. And we have probably a couple of, I think one of our sisters had asked the post thrombosis question, like what should we do like a year into or 2 year into? Maybe we may want to talk to anybody who's available on what should we be doing next. So yeah, thank you all. Thanks for giving me this opportunity.
One Damugar. Yeah, you.
I just wanted to say thank you, Uncle, for sharing those touching stories. I think it just shows us how important it is to move our bodies and to understand the signs and symptoms of when we're seeing the thrombosis. So now I have to move on to the third session of student presentations. And we're going to start off with Prasad. We're going to first start off with Prasad, and he's be on Zoom, and he's going to be talking about sickle cell disease, thromboembolism, and Dr. Kumar will be.
Can I share my screen?
Yeah, Prasad, go ahead, Prasad. Just give me a second. Let me make you the co-host first. Yeah, Prasad, let's see that we completed each in at least 4 to 5 minutes. We are already
Yeah,
running. Okay.
I just make it very short.
Yeah, thanks.
Yeah.
Prasad. Go ahead.
Are you able to screen my screen? Are you able to
Yes,
see my
we can
screen?
see your screen.
Okay. Hello all. I am Prasad Kunche. So today I am going to explain about the sickle cell anemia and thromboembolism. So firstly, we start with what is sickle cell anemia. So it is an inherited blood disorder which is characterized by abnormal hemoglobin, which is like red blood cells is become to be sickle shaped cell structures. So this abnormal shapes can mainly lead to the various complications, includes the thromboembolism. So you can see the normal red blood cell and the affected one. So particularly thromboembolism is a very serious medical condition that occurs when a blood clot break off and travel to the bloodstream to block a blood vessel. So here I want to be a clarity on a blood clot and a thrombus. So blood clot is a mass of hardened blood. So while thrombus is a blood clot of that attached to the wall of the blood vessel. So there is a lot of difference between the blood clot and thrombus. So genetic mutation. So how we get the sickle cell anemia? So firstly, I would start with the like human life. It starts with the 4 letters. It's just with the AT and GC. So it's a nucleotide. These are the building blocks for DNA. So it can encodes the GNA and particularly it encodes the protein and it forms the structure, cellular functions, organism. So our whole body, our whole mechanism is runs with the AT and GC. So imagine if is there any like alteration or light shift or any deletion in these sequences. So it will encode a different protein. That's called a mutation. Is there any change in the sequence? That's called mutation. So it's particularly someplace at like point mutation or like a chromosomal in particularly in sickle cell anemia. So it's a point mutation. So particularly single nucleotide mutation. So where you can see the HPP gene is the normal one. So where the point mutation, which is particularly change in the GAG to GTC, just a change of a single letter that can change the whole sequence that can encodes the different amino acid, which is glutamic acid to valine. So these change a single letter then causes to the abnormal hemoglobin that forms like a sickle-shaped red structures. So then you can understand the power of a single letter. So it's mostly located in the its changes in the chromosome 11 and encoded by the protein beta globulin protein. So it is mostly inherited from the parents. Like one is a carrier to the next generation. So 25% chance is mostly affected to the next generation. So mutation effects. So you can see now clearly. So this is the sequence mutation GAC to GTG. So this is the sixth codon for beta globulin gene. So where you can see. So the amino acid will encode a different protein that will change the whole sequence and with functions. So symptoms. So it includes like a brain crisis, like several pain in particularly bones, joints, like a fever, acute chest symptoms, and mostly it's like a stroke. So you can imagine if is there any like a water tube you can get like a stone. So it will like get more pressure to causes like a burst, like a damage. So it's happened in our blood vessel system. So it's sometimes it's mostly causes to health stroke, pulmonary hypertensions, like sometimes crucially it's organ damage and some vision problems. Yeah. Types of sickle cell anemia. So there are mostly HBSSC. This is the most common disease, like sickle cell anemia. So which is caused, they have the both genes of sickle cell anemia, inheritance of two sickle cell genes. So which is both carried by the parents. So the second one is sickle cell. Yeah, it's inherited with one sickle cell gene and another one is a hemoglobin C gene. Yeah, the third one is beta thalassemia. So it is also inheritance with only one sickle cell gene and another one with the one beta thalassemia gene. Again, there are two types like beta thalassemia normal and some of the mild one.
Yeah,
So the
Prasad,
current treatment.
we are almost 5 minutes up, Prasad.
Okay, yeah. Okay,
Yeah,
I'll just
last,
this is the
yeah,
current
if you can
treatment which is
conclude in a
approved by.
minute, yeah, it would be good.
Okay, so this is the current treatment which is approved by the drug 1998, and I want to most this is the future therapeutics. So gene therapy like CRISPR-Cas9 gene editing and stem cell and bone marrow, and these are the two recent drugs approved by the FDA in last December 2023, and the CRISPR-Cas9 in the future, like upcoming years, like 20 to 30, everything is gonna be like a personalized medicine, which is only through the gene therapy. Uh, the next one, yeah, current clinical trials. There is a lot of like more than 13 drugs are on clinical trials, which is approved, ready to the from FDA. So CRISPR-Cas9. So it is one of the revolutionary gene editing tool that can modify the GNA. So all the mutation genes are particularly only the positive way to do by CRISPR-Cas9. So particularly in sickle cell anemia, they are trying to edit within HBB, and some of the companies, Vertex and the CRISPR Therapeutics, they got approved by the drug and future directions. So here the mission by 2047 Modi, so which is they are trying to eradicate the whole sickle cell anemia by 2047. Yeah, that's all. Thank you.
Yeah, thanks, Prasad. Thanks for understanding. Next, Teja will take it.
In the interest of time, we are prioritizing the people who are in person only. So, the sequence will be just like you said, Vikrant Palari next, then it will be Sharan Ayurvedi, Asmita Achanta, Lasya Gardner, Patrika Matula, and then start with Mokshit Autula, Ritwik Aryati and Ravina. I hope everyone has already 90. So, we are trying to look for the people of each who are already here. Thank you. No, that's fine. Oh, Akshit. Okay. Peter, you can come. Oh, okay. Yes. Yes.
So, Vikrant, I guess we have your presentation here. No, you let
Alchemo
say your
Texas
presentation.
ఇది
No, I thought I had to like press something.
No. It's all.
No, I don't know.
నేను చెప్పినది మాట.
Is this yours?
No.
Shit.
All the way to bottom.
Oh, this one? This one, right? Right. Okay.
Good evening, everybody. My name is Vikrant, and I just want to say that it's truly an honor to be here, and I'm glad to present about hospital-associated thrombosis post-COVID-19. These are just the table of contents of what we'll talk about. So about thrombosis. Thrombosis is a serious condition when a blood vessel or multiple blood vessels are blocked with a blood clot. It can also happen in your heart. This can travel to different areas of your body, like your lungs, brain, or heart, ultimately leading to further complications. COVID-19 makes this condition worse, and patient makes it possible over severe disease. And this is the diagram between normal flow of blood and one in the case of thrombosis. COVID-19 impact on blood. This virus affected coronary arteries, causing plaque buildup to become inflamed and break off, which led to a heart attack. It created one of the most serious complications of COVID-19 infection and the risk of developing blood clots in the blood vessels. It can increase inflammatory response. It causes hypercoagulability, which is a tendency to thrombose, form clots. And this is a diagram of people being put in the ICU. And these are the long-term effects of thrombosing. People with post-COVID thrombosis may be more susceptible to heart failure or heart attack if you have severe or even mild form of COVID-19. It is extremely uncommon for your heart muscle to become infected by a COVID-19 virus. However, the virus can develop to issues that can affect your entire body, including heart damage. And prevention and management in the hospital setting. And what we can do to prevent and manage thrombosis during COVID-19 is early mobilization and compression devices and use of anticoagulants. And just in conclusion, COVID-19 significantly heightens the risk of hospital-associated thrombosis, particularly in severe cases. Implementing preventive measures such as anticoagulation therapy and early mobilization is essential in reducing these risks. As the long-term effects of COVID-19 continue to unfold, adapting hospital protocols to mitigate thrombosis is critical. These are just my references. And thank you all for your time.
Next class we have Karen. And COVID-19 with Dr. Ron.
Good evening, everyone. I'm Sharon, and today I'm going to introduce you to heparin-induced thrombocytopenia, or HIT for short. Over the next few minutes, we'll go to Over the next few minutes, we'll go over this agenda here. We'll have a short intro on thrombosis, followed by the significance and uses of heparin and how it leads to it. So, thrombosis. Thrombosis is the formation of a thrombus, or a blood clot within a blood vessel. This stationary clot can obstruct or block blood flow through the circulatory system. There are two main types of thrombosis: venous thrombosis and arterial thrombosis. Some examples of venous thrombosis include DVTs, SVTs, PEs, PVTs, RVTs, and JVTs. Arterial thrombosis examples include MIs, CADs, and PADs. So here's a representation. DVTs, deep vein thrombosis, SVTs, superficial vein thrombosis. CAD is coronary arterial disease, and PAD is peripheral arterial. Heparin. Heparin is a blood thinner extracted from mucosal tissue of hogs, commonly known as pigs. It's used in many medical settings, from surgery to treating conditions like DVT or PE. It's an anticoagulant that helps prevent blood clots by reducing the blood flow of the clot. It's given in acute cases, usually through an IV. It can also be given subcutaneously and works to prevent clots, not to dissolve them. Here's a general overview of heparin. It's usually administered for over a short time period. It's not fully effective. It's good in preventing clots, but it has its side effects. Some of the most common side effects include bleeding, hit, osteoporosis, usually over a long time, bruising and pain, allergic reactions, etc. Heparin has anti-inflammatory properties, but as established before, it has its own risks. It's used in acute cases, meaning that the situation escalates quickly. The severity and lethality are usually high. Here's a general overview of the weights and dosages. They depend on the condition. So for DVT, for example, we have 80 units per kilogram over a period of 7 to 10 days. For MI, 60 to 70 units over 2 to 8 days. And last but not least is the general guidance. Thrombocytopenia. The name thrombocytopenia refers to a lower than normal number of platelets, the blood cells that help clotting. But here's the twist. Despite the drop in platelet count, it can paradoxically increase the risk of thrombosis. The lowering of platelets causes the platelets to activate, and the activated platelets lead to more frequent clots. It's an IMD, or an immune-mediated disorder. It is officially classed as a DIIC, or a drug-induced immune complication. So HIT represents this dangerous paradox: lower platelets, but more clots. Relevance of COVID-19. COVID-19 causes clotting. Severe COVID-19 can lead to widespread blood clots or thrombosis, and many patients are treated with heparin to prevent these clots, increasing the risk of HIT. COVID-19 can cause a drop in platelet count, making it difficult to distinguish between COVID-19 and HIT. Both of them have similar symptoms, making the diagnosis of HIT harder in COVID-19 patients who are already prone to blood clotting agents. Hemostasis, or creating blood clots, also becomes a challenge. Treatment challenges. If HIT is suspected in a COVID-19 patient, heparin must be stopped, and alternative anticoagulants need to be used, complicating the management of both conditions. So here's how heparin induces thrombocytopenia. First, heparin is administered, and it goes and it binds with a factor called PF4. And this causes antibody formation, which marks the PF4 as a foreign substance, which leads to platelet activation. And thrombopoiesis, or the generation of platelets, slows down, leading to more desperate production of PF4, causing the activation of platelets. And these activated platelets bind together to form a thrombosis clot. So the first step to solving HIT is to stop the intake of heparin products. By stopping the use of heparin, we can prevent HIT, but that's not enough as the patient is at high risk and you need an alternative anticoagulant that does not cross-react with HIT antibodies. Some commonly used ones are bivalirudin and fondaparinux. So here you can see a representation of how that activated platelets come together to form a blood clot. There's about 30,000 new cases annually of HIT across the United States. Clots. So here's a representation of clots. So a normal blood vessel, as you can see over there, is free flowing, and there's a thrombus right there where the blood is clotted and the blood flow is stopped. And here's an embolus. So an embolus is a thrombus, but it breaks free from the main clot and it travels through the blood vessel. So clots can be dissolved in two ways. Naturally, they're broken down by a process called fibrinolysis, where the enzyme plasmin breaks down fibrin, the fibrin mesh holding the clot together. Cells called macrophages perform phagocytosis to clean up the debris. Medically, a medication called TPA can be given to dissolve clots by activating plasmin to break down fibrin. These are the references, and so in conclusion, heparin-induced thrombocytopenia is a rare but dangerous complication of heparin therapy. It represents a delicate balance between preventing blood clots and the risk of severe thrombosis. Healthcare providers must stay vigilant, monitor the platelet counts, and act quickly if it is suspected. By understanding the condition, we can ensure safer patient care and reduce the risks associated with this complex disorder. Thank you for your attention today. Let's continue reading and improving our understanding of patients like skin.
Okay, next up, we're going to have Charita Achanta, and she's going to be presenting renal vein thrombosis and then are we also going to presentation?
Nihira Kunapareddy has one slide in the presentation, so she's going to stand. Okay. So she's the second grader, Nihira.
Okay. And Nihira will also be presenting along with her.
Yeah.
Hi everyone, my name is Keita Sean. Together we'll be talking about renal vein thrombosis. There's the renal vein. The renal vein is a blood vessel that carries deoxygenated blood from kidneys back to the heart through inferior renal tract. It drains with filtered blood after kidney removes waste and unnecessary fluid. It connects from the inferior vena cava to the kidneys on both sides. So this is the inferior vena cava, and this is renal. So this is about renal vein thrombosis. It's a blood clotting forms in the vein and it blocks the outflow of the blood from the kidney. That's usually how it looks like. This is an MRI scan. So this is the clotting right here. It reduces kidney function. It causes swelling, pain, kidney damage, and failure. So in children, it doesn't happen mostly in children, but it does happen a lot in infants. About 2.2 infants out of 100,000 children develop renal vein thrombosis, and it usually occurs in infants that have diabetic mothers, often associated with dehydration and sepsis, which basically means that the body doesn't respond to infections properly, and it also causes long-term kidney damage. This type of discoloration happens very rarely, but we do sometimes see it. So the effects. So there is reduced kidney function, swelling, pain, kidney damage, which we already talked about, which leads to chronic kidney diseases. And there's also pulmonary embolism, which is the blood clotting breaks from one site and travels to the lungs. This is very life-threatening. So how to combat it? Rarely, some people go through surgery to remove the blood clots. There are also anticoagulants like heparin.
like heparin and warfarin, and these are like medications to prevent the blood from clotting. They're first given through IV for first couple weeks, and then they're taken orally. And there's also a catheter which will be placed into the vein to dissolve and remove blood clots and acid. So thank you, and these are just a quick fun fact. So the renal vein thrombosis is rare, but most common venous thrombotic event in infants. About 20% of all thrombosis cases in infants are renal venous thrombosis. And also, it is hard to diagnose early, so make sure whenever you see any sort of symptom, make sure that you tell a trusted adult, a trusted expert on this case.
About 62% of people who have RVT do that.
Thank you. Next up, we're going to have Lavia, and she's going to be presenting anti-phospholipid syndrome and thrombosis with Dr. Sunita Akula as her mentor.
Yeah.
Yes, but they changed the order so that the Zoom people will go.
Okay.
We do him.
After this. Okay. Last year.
Good evening, everyone. My name is Lavia Gajla, and I'm excited to talk to you all about anti-phospholipid syndrome and thrombosis. Throughout this presentation, I'm going to provide you with valuable insights and actionable takeaways that you can apply in your own life. Today, I want to delve into a rare autoimmune disorder that profoundly affects the body's immune system, causing it to erroneously target healthy cells into harmful ones. This misdirected immune response can lead to severe complications, notably the formation of abnormal blood clots. These clots can occur in various blood vessels, posing significant health risks. Often termed as sticky blood syndrome, this condition underscores the critical need to understand its implications for those affected. By examining the underlying mechanisms, we can gain a deeper appreciation of the heightened clotting risk and the challenges encountered by patients. This is an example of thrombosis occurring in the foot. Venous thromboembolism refers to blood clots that typically form in the veins, often near the leg. If a clot travels to the lungs, it results in a pulmonary embolism, which blocks an artery in the lungs. Additionally, coronary thrombosis occurs when a blood clot obstructs an artery in the heart, potentially leading to a heart attack. Symptoms of anti-phospholipid syndrome can include redness, swelling near limbs, rashes, nosebleeds, along with chronic headache. Rashes, on the other hand, are splotchy blue or red spots, usually occurring in the lower part of the body. Although it represents only 1% of thrombosis diseases, it is responsible for 15 to 20% of deep vein thrombosis cases. It can lead to various health problems, including stroke, heart attack, and kidney damage. The causes of this condition include genetic, hormonal, and environmental factors, and its complications can lead to serious issues such as stroke, heart attacks, and kidney failure, as mentioned previously. Are there any treatments available? Well, yes. Patients are typically prescribed with anticoagulant medication to be taken daily. Anticoagulant medicine, or blood thinners, helps prevent the formation or growth of blood clots by interfering with the blood coagulation process. Lifestyle and diet changes include reducing potassium-rich foods like leafy greens and broccoli, avoiding smoking, staying hydrated, and considering hormone replacement therapy, along with maintaining an exercise routine. HRT, hormonal replacement therapy, is a treatment that replaces hormones the body doesn't produce enough of. This is usually often used in menopause. The primary reason for monitoring your intake of leafy greens and broccoli with APS is due to their high vitamin K content, which can affect how blood thinners work. And thank you for listening to our presentation. Okay, next up, we're going to have Akshat Atmiya, and he's going to be presenting cancer therapy thrombosis on Zoom, and his mentor is Dr. Kumar. Oh, never mind, he's in person.
Hello, everybody. My name is Ashi Nakula, and I'm presenting.
Do you mind going that? Yes, of the camera.
I can see.
Yeah. Thank you.
I'm presenting on cancer-associated thrombosis, and also focusing on genetic factors and factor V Leiden mutation. So a little bit of overview on cancer-associated thrombosis. So first off, VTE or venous thromboembolism is a significant complication which is seen in cancer patients. And this contributes to obviously death, of course, but also morbidity and suffering of patients. Thrombosis risk increases in cancer due to a variety of factors, of course, with surgery and chemotherapy and radiotherapy, which can damage blood vessels and activate clotting mechanisms, which of course increases the risk of thrombosis. Additionally, certain types of cancers can also activate the body's clotting system, making clots more likely in the body. So how common is cancer-associated thrombosis? Around 20% of cancer patients develop cancer-associated thrombosis, and the risk, again, depends on per cancer type and stage. So the next slide. So to get a basic understanding of the three main factors of how thrombosis is really caused, is called the Briscoe's triad. So the three are endothelial damage, altered blood flow, and hypercoagulability. And a little bit about them is endothelial damage is really the damage of the inner lining of the blood vessels, and then altered blood flow, which changes the way of how blood flows, either faster or slower. And we also have hypercoagulability, which is increased tendency to blood to be clot, which is why we have anticoagulants, which stop. A little bit of how cancer is kind of tied into all of this is how cancer treatments like chemotherapy and radiotherapy, they can damage endothelium. That's how the first factor is really affected. And the altered blood flow, cancer patients may experience stasis, which is a slowing or pooling of blood. And then lastly, many cancers increase the body's natural tendency to clot because obviously they're going through chemotherapy and many forms of treatment. So this is a little diagram that shows all the variations of how clot can really form. Of course, we have obesity, immobility, which I think are the biggest reason of clotting. We also have factor V Leiden, which I'm going to be going over, and then hormones or pregnancy. So a little bit about factor V Leiden. It was discovered in 1994. It's the most common genetic mutation associated with VT, which is different than all the other reasons such as obesity and immobility, which this is something that comes in from the genetic factor, in which a single point mutation, as we've gone over before, is a single change in the gene encoding. And this makes it resistant to the protein activated C, in which that actually stops the factor B, which increases blood clotting. So with factor B Leiden mutation, the activated protein C really does nothing to the factor B, which continues to be clotted through the blood cells. And something that's really, really interesting is that factor V Leiden is really common in individuals of European descent, with approximately 5% being through Caucasian males and females, which, as you can see, is something that's not going to be affecting all of us over here because we're not Caucasian, but it's something to always keep in awareness because of the fact that these are I would say, the hidden factors of how blood clots occur, and knowing these is how we're going to be safe. So a study spotlight is the Clinic Cancer and Thrombosis study. And this was basically a study that was used to assess the risk of thrombosis in cancer patients with the factor V Leiden mutation over a 2-year period. So as you can see, they studied over 982 patients with newly diagnosed or progressive cancer. And basically they were genotyping to see if they had the factor V mutation. And once they did do that, they saw that the patients with factor V Leiden mutation had nearly twice the risk of developing VTE compared to those without it, specifically 13.9 versus 7.6%. So it just shows that factor V Leiden is a big factor of how blood clots do form, and basically the awareness of it being existing in the medical field is important so that we understand how to treat it and stop clotting to occur in the first place. And then additionally, this is another study on breast cancer. So this one studied on the drug tamoxifen, and tamoxifen basically reduces the estrogen levels in females, and basically in these cancer cells that with the reduced estrogen, they're able to not grow as much as they can. But with the factor B Leiden, we saw that 18.5% of women who had thromboembolisms carried they carried 18.5% of women carried that compared to the 4.8% without factor B Leiden. So it is a huge factor in multiple individuals with thrombosis and needs to be aware of. So lastly, clinical implications, how can we basically stop blood clots in the future? Testing is a huge thing. Obviously, you want to be testing for blood clots and making sure that it doesn't happen in the future. But additionally, you also want to use prophylactic anticoagulation, which is a really common therapy used to help cancer treatments to prevent blood clots during cancer. But I think a big one for me is especially someone who I see myself as someone who's really interested in artificial intelligence. And a possible AI tool is to be using personalized treatment plans that identify risks and associations with cancer-associated thrombosis, and using that to provide personalized treatment plans for individuals with cancer to stop blood clots from ever happening. And then patient education awareness, of course, is always huge. We want to make sure that everybody knows about blood clots and to, in the future, understand how to stop them. All right, that's the end of my presentation. Next slide shows the references.
Thank you. Yeah, let's call the poster presenters. Okay, yeah. Yeah, so we have a couple of middle schoolers. I think they're middle schoolers or elementary schoolers. So a couple of poster presenters. So one is Rishita Arisankala, and the other is Kaivalya Sainagiredi. If you want to come here, show your poster and talk about the content in the poster, it would be good. And guys, please encourage them. The camera. Oh, okay. Oh, we'll stop here.
Hi, my name is Rishika. I'm in fourth grade and I have read Christiana Elementary School. Today my topic is blood clots risk in pregnancy. How blood clots form. Normally blood moves smoothly along the blood vessel, but sometimes there can be a blood clot which stops the blood from moving. Blood clots are usually helpful when you have a cut because it stops bleeding. But when they form inside your blood vessel without a cut, they can cause problems by stopping the blood from flowing where it needs to go. When a mom is pregnant, sometimes to keep the baby safe, the mom's body will make the blood thicker, like a syrup. This helps to stop bleeding if the mom gets hurt. But if the blood gets too thick, it could cause blood clots, which could be a problem because the baby and the mom knows only the blood we hope to get mom's blood get thicker because her body makes more blood.
Yeah.
How to prevent blood clots during pregnancy, make sure to stay active, vessel regular, stay hydrated, and careful. Elevate your legs or rest with your legs. 4. Wear compressions. 5. Follow medical advice.
Nine.
Hello everyone, my name is Kaivalya Sai in fourth grade. Today I will be presenting a poster of Serena Williams' her experience with pulmonary embolism. So what is a pulmonary embolism? A pulmonary embolism is a blood clot that develops in a blood vessel elsewhere in the body. Often the blood travels to an artery in the lung and suddenly forms a blockage of the artery. And what are the 5 warning signs of a blood clot? Signs and symptoms of a blood clot. Swelling, usually in one leg or leg pain or tenderness, often described as a cramp or a Charlie. Reddish or blush skin, discoloration, leg or arm warm to touch, or shortness of breath. Now we will be reading a small passage about Serena Williams and her experience with COVID-19. Serena Williams shared her experience with the pulmonary embolism, PE, after giving birth, which was complicated by her history of blood clots and an emergency. Intentionally, her concerns were dismissed by medical staff. The CT scan confirmed she had PE with clots in her lungs. She was treated with a blood thinner, but it led to hemorrhage and C-sections. A filter was later inserted to prevent more clots. Deep vein thrombosis, DVT, can lead to PE, a life-threatening condition, and Serena's case highlights the importance of recognizing symptoms and advocating for them. Thank you, everyone, and ladies, what about make us safe?
Okay, just hold on for a couple more presentations. We're going to have Satmika Agula next, and she's going to be presenting dental health blood clots, and her mentor is Dr. Venkat Vyuda.
Satvika. Fine, na? కిందక oh the middle one oh back here okay gotcha yeah.
Hi everyone, I'm going to try to keep it short in the interest of time. So yeah, my name is Satvika, and I'll be presenting on like a new aspect on thrombosis in these things and on the link between oral bacteria and disease. So what is ischemic stroke? Ischemic stroke is essentially what we were talking about, but in the brain, a blood clot that travels through an artery and cuts off circulation to the brain, ultimately killing the cells. And unfortunately, this is the most common type of stroke, accounting for 87% of all cases. And oral infection comes into play here because the bacteria that is in chronic periodontal disease travels through the bloodstream and essentially causes. In addition to causing 87% of strokes, ischemic stroke is important because it's now the leading cause of adult long-term disease. So specifically, what is the connection between oral disease and ischemic stroke? So in oral bacterium, there's a subset called Variant streptococci, which has been found in coronary thrombus and cerebral aneurysms. And this study that I'll be presenting on, which has delved into finding the specific bacterial DNA that is found in the thrombus. So this study started off with collecting samples from 75 patients with ischemic stroke, and then went on to assess the presence of bacterial DNA using quantitative polymerase chain reaction. And they went in looking for certain bacteria, and then they used a comparative analysis to essentially see what this indicated and see if there was a change between arterial blood and thrombus blood to see bacterial DNA from oral infections really did make a difference. And essentially the answer is yes. Bacterial DNA was found in a majority of thrombus, and of this bacterial DNA, a majority was from the S- group, which is a Streptococcus variant. So what does this mean? This study essentially established a link between oral bacteria and stroke pathogens. And this means that we can take good care of those early life. Guys, we need to ensure that we have improved oral health, good dental care, and just make our biannual visits to the dentist. And this also opens up an avenue for therapeutic interventions, antibiotics, and other ways to combat thrombosis and prevent it. While this study is very novel and important, we have to understand that the scope is limited by the sample size and the fact that they only use PCR, which doesn't do a good job of detecting or distinguishing the type of bacteria. And going forward, we need more inquiry and a deeper assessment of the connection between bacteria and vascular and immune systems to truly establish a link that we can concretely. And that's it, thank you. And this is a little picture after I did a presentation at a club that I'm.
I need to say a couple of words about Satvika. Satvika is a proven leader. Why I say this? Because I learned the Thrombosis Day presentation format and everything last year from Satvika, and I followed the same thing this year. And despite of her busy schedule and exams, Neha and Satvika, they came all the way from UT Austin, and they volunteered. She did all the reviews, and Neha did the MC today. And thanks, guys. I think Prakash Garu will drop you now. You can go ahead and I'll take over the next three. We have three talks. It's on Zoom, so yeah.
Good
Thanks
job,
again.
Satvika.
Again, Satvika.
Thanks, Satvika, and thank Neha. Without you guys, it's very difficult. As I told you before many times, thanks for your time. And these two are great leaders. And this kind of leadership we want from everyone. And then, Satvika is planning to go into dental school. And Neha is want to go to medical school. So we'll cheer them up. We'll see they get succeeded in their lives. Thank you.
Yeah, the next presentation on Zoom would be from our Ritvik Nallam. And I think the topic is cerebral venous sinus thrombosis, CVST. Ritvik, if you're on the call, you can go ahead and share your screen.
Sure. Give me 1 minute.
Okay, give me a second, Ritvik. Yeah.
Is my screen visible?
It's loading, Ritvik. Yeah, it's visible now. You can go ahead.
Good evening, everyone. My name is Rivik Nalam. I'm a fourth-year medical student, and today I will be talking about cerebral venous sinus thrombosis. And I'll try to make this as quick as possible. So cerebral venous sinus thrombosis, or cerebral venous thrombosis, CVT, CVST, is the presence of a blood clot in the cerebral veins and or the dural venous sinuses. It's a relatively rare condition and constituting only around 0.5 to 1% of strokes. But one thing about it is that the prognosis for recovery is very good. Around 80% of patients who do get CVT will have a complete recovery, with the remainder having either minor or major complications leading on. But before we can really talk further on, there was a previous presentation already on cavernous sinus thrombosis that already covered it, but I'll just quickly talk about it as well. The cerebral venous sinus is basically the venous system for the brain. Now, unlike in our body, where the arteries and veins are together, in this case, the venous drainage is separate from the arteries, and this is in the dura mater. The most common areas from the cerebral venous system, it will go into the internal jugular vein and enter our systemic system and going through into our heart and being pumped out again. Lungs. And so most common sinuses involved are the superior sagittal sinus and transverse sinus, as well as the cavernous sinus. So what are the risk factors for developing a CVT? Like any thrombosis, based off Virchow's triad, we can determine what are the risk factors. The main ones in this case are what increases the hypercoagulability or the increased thickness of the blood. And these include oral contraceptives, as well as pregnancy and post-pregnancy state. Further, it can also be due to clotting disorders like factor V Leiden or antiphospholipid syndrome. Apart from genetic and drug-induced. It can also be due to traumatic, specifically head trauma, or even iatrogenic, like a lumbar puncture. It can also be due to some autoimmune disorders like inflammatory bowel disease or Behçet's disease can also increase the risk. And then you have the infectious causes. Any head and neck infection, like your simple sinusitis to tonsillitis, to even otitis media, can all increase your risk for developing a CVT by increasing both the hypercoagulability and all three components of Virchow's triad. So what are the clinical features? The clinical features will vary with which sinus is involved, but the primary symptom that most, if not all, patients will present first to the doctor is with a headache, followed by nausea, vomiting. Then you'll also have seizures. Some patients will have seizures. Some patients will have double vision or any other visual disturbances like vision loss. But it can, depending on, and this is due to the increased pressure caused by the thrombus. The thrombus will reduce the cerebral drainage that increases intracranial pressure and result in these symptoms and signs as well. And based off what are the presentation of the patient, we can determine which sinus is involved. So once the patient, you've taken a detailed history, you've asked and you've clinically examined the patient and you're suspecting CVT, next the physician will go for an investigation. The gold standard and preferred investigation is an MRI with venography. One of the main advantages is that it's non-radiating. However, there's no radiation risk. However, in case MRI is not available, a CT can give us the same exact information, and it will show us, CT MRI will show us a hyperdensity and the lack of flow in a thrombosed sinus, as well as two important signs, the empty delta sign and the cord sign or cashew nut sign. Further lab tests that are done are for the risks of thrombosis, such as a complete blood count, platelet count, prothrombin time, and activated partial thromboplastin, as well as a D-dimer. These are typically done. Further tests can be done based off symptom etiological investigations determining the cause. And if the patient has a seizure, we can even do an electroencephalogram. Management. So this is based off the American Heart Association and American Stroke Association's guideline. So after we have confirmed CVT's presence, if there's no evidence suggested based off imaging, we have to consider another diagnosis. If CVT is confirmed, then we have to determine what is the cause of the CVT. Is it due to OCPs? Is it any autoimmune disorder? Or is it due to an infection? Based off that, because it allows us, by finding the etiology, we can actually prevent further risks of further episodes again. Then we need to start the patient on low molecular weight heparin. This is the initial treatment that is given. And based off how the patient does after follow-up imaging and clinical examination, we can either, if the patient is stable and they're improving well, then we can put them on a long-term heparin. And that depends on each specific patient, whether it's going to be for 6 months, 12 months, or is it going to be a lifetime. If, however, medical management is failing, then we need to consider more invasive procedures. And one thing that needs to be considered is endovascular therapy. It's considered in cases where medical management fails or there's a contraindication to giving anticoagulants. And we can do an endovascular thrombolysis or a catheter thrombectomy. If there's also a mass effect as from the increased hypertension that's causing your visual disturbances, then we might need to consider, or there's no improvement of symptoms, then we might need to consider decompressive hemicraniotomy or even a hematoma evacuation. But this is all dependent on each patient and their unique presentation. But the main goal further is prevention. So maintaining a healthy lifestyle, can reduce the risk as well as having a follow-up. See, one of the most important groups that needs to be followed up are young women on OCPs as well as pregnant females in their third trimester, as these can complicate further down the line. And that's all I have. Thank you.
Yeah, thanks so much, Ritvik. I think you joined from India, right? Yeah, it must be early morning for you.
Yes.
Yeah, thanks, Ritvik. Next, we'll move on to Arya V. Chikala. Arya V. Chikala is presenting on inherited thrombophilia, and her mentor is Dr. Kumar Kutpalgar.
Do you want me to share my screen?
Yes, Arya, just give me a second.
Sure.
Can you share your screen meanwhile?
Sure.
Yeah.
You just, yeah. Okay. I'm going to share my screen. Can you see my screen? Can you see my screen?
Yes, Arya, you can go ahead.
Okay, perfect. All right. So let me close this. Okay. So hello everyone. My name is Aryahi. I'm a senior at Bordentown High School in New Jersey. And the topic I picked for World Thrombosis Day is inherited thrombophilia. So what is thrombophilia? Thrombophilia is a blood disorder that makes the blood in your veins and
Check. We can see your Google Drive window, not the
really?
actual presentation. Yes.
Sure. Okay, then I'll stop sharing.
Yeah, stop sharing and share your current screen, and then
Okay. Okay. I think you can see it now, right?
it's loading. Yeah, we can see it.
Okay, perfect. Thank you for letting me know.
Sure.
Yep. So I'm just going to start again. So what is thrombophilia? Wait, I have a quick question. Can you see like my picture here at the bottom? Or can you...
Not
No?
your picture. No.
You can just see my screen though, right?
Yeah, I just see your full screen presentation of what you're presenting based.
Okay, perfect. Thank you.
Right.
All right. So what is thrombophilia? Thrombophilia is a blood disorder that makes the blood in your veins and arteries more likely to clot. And there are several inherited gene mutations which are linked to be risk factors for thrombosis. So again, thrombo means blood clot, and thrombophilia can increase your risk for deep vein thrombosis. So I know this was mentioned in the other presentations, but deep vein thrombosis is a blood clot in the vein that's located deep within your body. And then pulmonary embolism, which is a blood clot in your lung that creates a blockage in blood flow and also restricts oxygen levels. And in the picture here, you can see that in a blood vessel that's normal, there's a normal sized blood clot, and then over time that clot breaks down. So it's working fine here. However, when the blood vessel is affected by thrombophilia, there is excessive blood clot, and over time that clot doesn't break down properly. And this can cause some problems and blockage in the blood vessel, and this can once again restrict oxygen levels. So it's a serious thing. And then I'll be talking about types of genetically inherited thrombophilia, and this is just in the order of most inherited to least inherited. So like this is like the most inherited, factor V Leiden. And factor V Leiden is the most common hereditary type of inherited thrombophilia. And the Cleveland Clinic reports that in the United States, about 1 in 20 people of European origin are affected, and 1 in 100 people of African or Asian origin are affected. So this means that mainly people of European descent are the ones who are affected by this factor V Leiden. And coagulation is the process in which the blood clot is formed. So I'll be using this term a lot in my presentation. So that's why I wanted to define it.
And the coagulation process is it leads to hemostasis, which involves roughly 30 different genes and blood plasma, and that contains 12 clotting factors and proteins. Now, the affected gene for factor V Leiden is the F5 gene, and that gene instructs your body on how to properly assemble the factor V protein. Now, the anticoagulant response is when the factor V Leiden mutation causes the factor V gene to resist the actions of protein C and protein S, which normally deactivate factor V in order to keep blood from clotting abnormally. However, in a faulty anticoagulant response, this means that the factor V gene continues to produce blood clots, and that makes your blood more likely to clot even when it shouldn't be clotting. So that was what I was talking about earlier. Excessive clotting can cause some problems. And now prothrombin, 2210. So prothrombin, this is another genetically inherited thrombophilia condition. And to give some background about this, prothrombin is one of the blood clotting factors that circulates in the blood. And when it's activated, it converts into thrombin. And thrombin causes fibrinogen, which is another clotting factor, to convert fibrin strands, which are configuring part of the clot. So this is just like the structure of a clot. And the importance of this is that the inherited prothrombin gene mutation, factor II mutation, also known as prothrombin G2210A, is increasing the susceptibility to develop abnormal blood clots in the veins. And once again, this can cause deep vein thrombosis, and if this happens in the lungs, that's pulmonary embolism. And this prothrombin 2210 is the weakest of all inherited clotting disorders in terms of risks of causing abnormal blood clots, since it only increases the risk of vein clots and not necessarily the risk of myocardial infarction, which is heart attacks or arterial strokes. So it's not as serious as some of the other genetically inherited thrombophilia conditions, but it is still serious. This is because the body produces an excess of the factor II prothrombin protein, which you'll need for normal clot formation. So this is just the pathway. So you can see that normally, sorry, I have to pull something up. So normally the prothrombin gene is going through the increased production of prothrombin, and that means that the blood is going to be more stickier than how it usually is formed, and that can make you more susceptible to blood clots. And this is protein C and protein S deficiency. So protein C and protein S are some of the natural anticoagulants which are found in the blood. And an anticoagulant is a substance that prevents blood from clotting. So if you don't have enough of the protein S or C, that means you're more likely to have venous thrombosis. And that causes a higher risk of reoccurring blood clots, especially if both of your parents are carriers of this condition. And protein C and protein S is inherited in an autosomal like dominance. So that means that if one parent has it, there's a 50-50 chance that you will inherit it. And in this picture here, I kind of showed what this means through like a diagram. So inheriting protein C, this means it's like extremely rare for both parents to have it. It's less than a 1 in a 1 million chance. So if the child does not inherit it from both parents, this is known as homozygous protein C deficiency. And now babies that are born with this condition have skin thromboses as soon as they're born, and they need protein C concentrates or other anticoagulants to prevent further thrombosis. So an example of anticoagulant is like a blood thinner. So this can help prevent further thrombosis. And the incidence of Pro-C gene mutation, so Pro-C is just protein C. So a child of a couple in which one parent has a single protein C gene mutation has a 50% chance of inheriting that mutated gene. So if that happens, the child will be heterozygous and having one mutated protein C gene and the other will be normal. So if a child of a couple in which both parents have the mutated Pro-CG, gene have a 25% chance of getting both copies of that mutation, and the child will have a much lower protein C level, and that means they'll be more severely affected at birth. And moving on, antithrombin deficiency. So antithrombin, previously known as antithrombin 3, is one of the natural anticoagulants found in blood. Now, if you don't have enough of antithrombin, you're more likely to have a venous thrombosis. And clotting can continue without enough antithrombin to stop it. So this is why you should get a deep vein thrombosis in your leg, this is why you can get a deep vein thrombosis in your leg or pulmonary embolism in your lung. And then moving on, inheriting antithrombin deficiency. So people who have a mutation on their SERPIN-C1 gene have antithrombin deficiency. So antithrombin deficiency is inherited in an autosomal way, meaning that if one parent has it, there's a 50-50 chance that their child will inherit it. And it's extremely rare for both parents to have it. Like the prevalence is 1 person in every 2,000 to 3,000 people have antithrombin deficiency, so it is rare. If a fetus inherits it, it's known as homozygous antithrombin deficiency, but sadly in the situation, the fetus does not survive. Okay, so conclusion. If you have genetic thrombophilia, you should get medical advice before a major surgery or if you're unable to move around for a long period, since this increases the risk of venous thrombosis. Individuals with genetic thrombophilia can have reduce their risk of venous thrombosis by making lifestyle changes, by simply exercising and having a healthy lifestyle, having a healthy balanced diet as well. And women who are pregnant or planning to get pregnant should have medical advice before taking oral combined contraceptives or hormone replacement therapy. They're the ones who are most susceptible and getting this. And family members that have genetic thrombophilia and any close relatives are advised to get tested under the advice of a healthcare professional. And in case nobody has venous thrombosis in the family, there's a lower risk factor. However, if a number of members in any have any inherited form of thrombophilia, and they have the venous thrombosis, then their risk is much greater. And you can reduce this risk by taking preventive measures and consulting a doctor. So it's always better to get this checked out. And that's it. This is my works cited. Thank you.
Yeah, thank you, Arya. I think that is it, Kumar Garu. Raghuman Akhtar, she's not here. She's not on Zoom. So, do you want to just say a few words before we conclude? Yeah, thanks.
Naka is Ravi Garu Suji. So Ravi Garu
Ravi garu unnaru anukunta.
Let us conclude.
Yeah, we wanted to conclude it with your speech, sir.
Thanks everyone for joining this World Thrombosis Day awareness event. Kids have presented so well. Congrats Amma Andaru, Chinnappillalu, elementary schools, high school, middle school, and then pre-matric residents, residency aspirants. So I would like to thank Shashank Namala and Teja Kunapreddy Garu for organizing this, and they have put a lot of effort in making this event successful. Thanks Ramu Garu for coming here and sharing your personal experience. It's a lot for most of the audience, and they might have learned, how to prevent these clots if it happens to any family members. Take action. Action is the first thing, and it has to be done immediately. So I would like to thank all the doctors who have mentored the kids. Dr. Ravi Atul Garu, he has spent a lot of time with the kids, guiding them, and any help, he is readily available for any of the members here. Dr. Ram Kalagaru, he trains students in his hospital. Dr. Surya Rutu Garu, he sent student Soumya Maji for here. She's trying for residency. We wish all her good luck. And I would like to thank Satvika and Neha for doing a great job in organizing and putting all these slides together. And each and every member of the team who has presented 20 oral presentations and posters, everyone, thank you and good luck with your future. With this, I would like to thank UPASA and Atmiya, all the members and the donors for making this event successful. Thank you so much. Have a good night.
Yeah, everyone on Zoom, thanks and join in on the call. I'll be ending the call.